Welcome to the regular meeting of the Orange Board of Finance. Today is Monday, December 20th. We'll call the meeting to order at 7:09 and have everyone introduce themselves, beginning on my right.
Kevin Moffett.
Kevin McNabola.
John Cifarelli, Finance Director.
Joe Nuzzo.
Jim Leahy.
Ajit Jain.
Kevin Houlihan, thank you. Item number 3 is public dialogue. Is there anyone who wants to speak to anything that's not already speaking to something else on the agenda? No. Okay. So, item number 4, funding requests. A memo from Christy Massey Teixeira, the RN Orange Board of Health Chairman, requesting funding from the American Rescue Plan. Discussion and possible vote to fund request. So, John, do I turn it over to you or to Christy?
Yeah, why don't you?
Welcome.
Thank you.
Okay.
Hi, everybody. Nice to meet you. My name is Christy Machi. I'm the chairperson for the Board of Health. Earlier in November, we submitted a proposal for the coronavirus state and local recovery funds, which are part of the American Rescue Plan Act. And I know there were some comments on that proposal, so we updated the proposal. I can send an electronic copy as well. Oh, sure, thanks. Thanks. So we made some updates, and basically the funding request has decreased by almost half. You can see the changes there. We got rid of the second nurse. We got rid of the administrator vaccinator. Removed some line items that First Selectman Jim Zioli had comments on. So basically just looking to see if you can review and approve our request. We also need to know what a fair hourly rate is for the nurses. I know that was a comment that First Selectman had, that our hourly rate for the RN was incorrect. So just, I don't know who can tell us what a normal hourly rate would be for the nursing staff. And just if there's any questions on that.
Sean, is there a rate that's negotiated?
There's a negotiated rate for the school nurses that are union, but there's an hourly rate that the OVNA uses, and I don't know what it is offhand. I'd have to look it up.
So that would change this.
Right.
And that's to provide approximately 24 clinics, so about one weekly over a span of 6 months. And, we're pretty late already. We would have liked to have been, able to handle the clinics a bit earlier, just given the season and given the rates that we're experiencing right now. It could be for first-time vaccinations or for boosters.
Kathy, I have an awful lot of questions. Should we start?
Christy, sure,
Thanks for coming.
sure.
I'm not sure how much, with a mask and glasses fogging up, how fluid this will go. I'm seeing a spreadsheet, but I really don't have context. So the first context I'd like to understand, I'll even go back without a spreadsheet.
Could you just point that microphone towards your face?
Okay.
Thank you.
Feel free to tell me that my voice is not coming through this mask well.
Okay.
I'll
No,
speak
so
up.
far, so good. Thanks.
What problem are we trying to solve here?
Offering, well, this is part of the basic duties of a Department of Public Health in town. I have my colleagues Amir and Brian here. Amir will talk a little bit about this too. As a town Board of Health committee, we're responsible for offering certain services to our town, and this is part of them. So this is one of the essential services that we're responsible for providing to our town.
I went over to Yale, over on the other side of Route 95, and got vaccinated twice over there.
Mm-hmm.
How does that activity compare with what results in this coming before us tonight? In other words, that's what I did. People go to doctors and do this. People go to drugstores and do this.
Mm-hmm.
I was at a luncheon last Monday, a week ago from today, and I saw signs in parking lots saying, call this number and you can get this service. So help me understand why this is in addition to all those other ways to get vaccinated.
Yeah, so certainly that's one of the options. This is just to offer another option to our residents. Again, going back to the fact that we're part of the Board of Health, it's part of the services we're supposed to be providing for our town residents. Certainly, the residents can go other places, but we should also be offering them something here if they want to come and get this through their town.
I think you also, if I understood it right, that this was done once before.
Yep, we had a vaccine clinic earlier in the year.
When was that?
April of,
So we started January till May.
so January to May of 2021.
21? Okay, so this year.
When the
Eh.
first wave of vaccines were approved, so we offered almost 2,000 vaccines.
Okay. My understanding is that a high percentage, almost maybe 50%, were not from the town of Orange. Can you help me understand how that can be?
Sure, do you have the breakdown, Amir?
So good evening. My name is Amir Muhammad. I'm the Director of Health. Thank you for inviting us, and I closely work with Christy and other members. I have my staff member, Brian Slagowski, here as well.
Hi,
So we watched the last Board of Finance meeting, and thank you for this opportunity. So we want to clarify. So I would like to pass on to the chairman to see these are the 10 essential services of the Department of Public Health. And what we were tasked last year was a huge, responsibility to vaccinate when the first wave of vaccines were approved. So during that time, we were not ready. So all those plannings and hard work went into play to offer, and this was primarily through the State Department of Public Health. These vaccines were only given to local public health department before they were started to be given to Yale Health Systems and all that. So we were tasked, all the local health departments throughout the state were tasked to offer the vaccines to their residents, and we did that. And during that time, for almost 6 months span, we gave almost 1,900 folks the vaccine for the first time. So
This was January?
this was end of December, going into January, up until May of 2021.
Okay, so I got my first vaccine over at Yale in March, so they probably started in February.
Late, yeah.
Okay.
Yeah, so given the scope of the work, we realized that this is really, a priority, given the pandemic, and looking internally that we were under-resourced and understaffed. We only relied on volunteers. Myself and one nurse from OVNA were the only staff member from the health department that were part of this project.
Okay.
So this is just the background, and DPH gave us the strict rules. We had to store it, properly. Mr. Cifarelli was kind enough to give us all the resources to buy the refrigerator, backup generator, because those were strict guidelines how to store those vaccines. We never had that before. So with the support of our finance department and with the first selectman, we were able to offer this large scope of vaccines, and we had volunteers like Christy herself and other nurses in the town that we use them as our vaccinator. We also know that we have to fulfill the essential service as a local health department, and what we realized during the course of the work that this is part of the essential services. And I keep repeating this word because it's encompassing some of the activities that we have to offer. And John knows that I have always consulted his expert advice, not knowing how much of the finance department works and all that. So fast forward this time or summer, we were informed about the funding, and I have to provide annual report to the Department of Public Health. What services do we provide as a town of Orange to the services? And we, Brian, myself, and Lisa from OVNA, we submit the report. And unfortunately, before the pandemic in 2019, we did not pass the report. And I have a copy of the results from the DPH audit that we had not met, and I would pass it on to the chairman. So this is just one piece of the service that we are trying to accomplish without being a burden on the town's overall budget.
I just read all 10. Could you tell me which of the 10 identifies this?
All of them.
All of them?
pretty much, because we're doing the disease surveillance, we're doing the contact tracing, we're providing, vaccinations to those who are unable to obtain, or, we still are doing the homebound.
I don't see anything here that says you're supposed to be doing vaccination. I was looking for you should be vaccinating
No,
during
it's
pandemic type of-
encompassing. That's what I'm trying to say. These are the services, and I didn't go into the details specifically. I've also provided the audit report. So vaccine is just one part of because we're in pandemic, and that's the only effective means that we can, protect our community with the public health, safety, and wellness measure. So that will fall under all those headings pretty much, for the safety and wellness of the community. Encompassing. It's one of the tools that we will utilize to protect our community.
Based on the audit report, we didn't have any of that documentation in
Correct.
place.
Policies, personnel, and outreach. So this is why I'm concerned, because we're going to be audited again. This is the annual process. I took this job end of 2016, and I still, was able to manage because we were not facing the pandemic. And I wanted to come earlier to this board to make you aware of all the areas that we need to focus on. And when the crisis hit, I also find opportunity to improve ourselves. And it's all for the town of Orange. I mean, this is strictly business or professional, nothing personal. Department of Health is not going to benefit from this. The community will benefit from that. And, our department is labeled as part-time health department, and these are the job descriptions of the director of health that I would share with the chairman. And I would like to fulfill all the, all the required essential functions of the job. I cannot do that without having essential personnel. And therefore, I think this is the opportunity.
But I go back to what problem we're trying to solve, right? Here it is 2021, right? Unlike last year, there are numerous, including in this town, other health services, I believe. And I don't know how they fit into what you all are doing, okay? But we're here, this board,
Right.
about the finances of this town,
Correct.
which leads to taxes on the citizens of this town, okay? So that's all where I'm coming
Right.
from. So I read this, and this is pretty general, right?
Right?
You could probably justify, if you could justify this over here and show this, and this, for some reason, if anyone thought it was justification, you could probably justify a lot of stuff under here. This is rather general, and I notice it's from the CDC. So I'm going back here
Yeah.
as to what is the need, what is the problem we're trying to solve?
I'm getting there, right?
Just one point of clarification too, this is not part of our fiscal year budget that we're submitting. Our fiscal year budget was neutral, last year to this year, it's only $850. The funding that we're actually requesting is part of funds that were allocated, emergency funds that were allocated to each state and each town to deal with coronavirus.
And it's up to the governing bodies in those towns,
That's correct,
right? And this is called the American Rescue Plan Act, right?
correct.
Okay, because I noted that, at
We-
least in one of the memos
Yeah.
that I didn't get, because we didn't have the right email address, I noticed that here it's called the Corona State and Local Fiscal Recovery Fund, and that's something I've never heard of, and I don't think
This is-
exists. So I come back to what problem we're trying to solve here, as if, let's just put it this way, all right? My older sister, all right, she lived in town with, let's say, I'd say, okay, I'll take you to the doctor, we'll get your shot, right? All right, we have other facilities in town by which we can get these shots, okay? We can go to Yale if Yale opens up and is doing it again. I'm not aware if they are or not, so I could be very easily corrected on that. I'm trying to understand the priority of why this body needs to be doing it.
I don't know the answer why this body has to approve everything, but I'm
No, I'm talking about this
Yeah.
effort. Why this effort is required
Oh,
for the benefit of the citizens of the town of Orange, as if,
Right.
and no offense to anybody, but this is our job to ask these questions, at least mine, I feel it is. all right, is why is it that this is required when there's all these other opportunities to get this vaccination service? That's where I'm hung up.
Well, I can tell you this is just piece of these services that we are making sure that this gets fulfilled. However, I also shared with the chairman the staffing level that is required to not just offer the vaccine, but also other pandemic-related activities. So just to give you an example, we have had 50 cases since December 1st. We are required by state regulations to contact each person who came back positive and do what's called contact tracing.
50 cases of what?
Positive coronavirus.
What kind of coronavirus?
There's only one kind of coronavirus,
Okay.
COVID-19.
When my girlfriend got coronavirus last year and nearly died, I would call that one kind of coronavirus, okay? When another person gets a coronavirus
Yeah.
and is asymptomatic but took a test and found out that they had coronavirus, that's a very different type of, to me, that's a very different type of coronavirus.
So there is different variant, but it's the same virus that has different variations. So right now is the Delta variant, and you may have heard about Omicron. So those are the
Yes.
two widely spread, highly contagious strains of the virus that are being circulated in the state and community. So if that answers your question about what type.
No, that tells me there's different types, okay?
Yeah, there's going to be more variation that may come later on, who knows? But
Right.
it all depends. So this is just the vaccinations or the clinic that we had offered or we plan to offer in a continuous basis is just one piece of the puzzle that we're trying to solve in terms of having adequate staffing and services so we don't have to come back again and request. So we wanted like a stable funding going forward, knowing that the pandemic is not going to be over. And the request for example, the public health nurse that we're requesting is not just going to be doing vaccine clinic, but many other activities that we want to be self-sufficient
Okay.
in performing.
Help me understand. I mean, I thought that what we were doing was vaccinating our population.
We will be.
No. In writ large, not society's vaccinating its population to the extent that individuals wish that. Okay. Now, I'm trying to understand, since there are so many offerings in which to get this. Again, I coming back.
Yeah.
Why is this necessary? In other words, is there a segment of Orange that has no other way to get vaccinations other than to have something like this in the town of Orange?
We don't live in a rural world that we don't have the access to, but how would you imagine that from end of January till May, almost 2,000 people chose us, despite
What percentage of those were from Orange?
100%.
That's not what I heard.
I don't know what you heard. I have all the
John?
data.
Something's missing here. Of the 1,800 people you vaccinated.
Yeah.
How many of those were from Orange?
Those all were from Orange.
No,
Yeah.
no.
Because we had offered to when the clinics were set up, it was open to anybody who could come in. But then we had to restrict it. I have the Excel file because we were the one, I made the schedule. I called people to schedule them. It was the neighbor, it was the entire family and what have you. So I can share with that, or you may have that Excel sheet. However, the point is, it was, even if it's 90%, say for example, that these were all Orange residents. It was focused, it was an Orange COVID-19 clinic. I signed the papers.
Yep.
Based on my request. The state gave us the number of vaccine. Everything was accounted for. We followed the regulations to the T from the DPH that we have to offer the vaccine regardless of the vaccination, their gender.
Dr. Muhammad, while you're talking, you've made a statement that John does not agree with, and that we have taught. You mentioned that you watched the last meeting that we discussed this, and
I
that was
did.
one of the items discussed.
Yeah.
I also heard that we would have been reimbursed.
I was
for
going to
this.
get to that, Mr.
Okay,
Leahy.
okay.
Yeah.
But if you're so certain, no offense.
No.
But if
I'm
someone
trying
tells me
to.
we know they're all from Orange, and they brought the family, we
Yeah.
know their address, then
We-
we know the information from which to get reimbursed.
I have that information, so I'll tell you about the reimbursement part, which kind of a little bit confusing to
Okay.
me. So when we started in January, started vaccinating, there was no code for billing. This is a completely brand-new disease and vaccination. We got the vaccine from DPH. DPH got the vaccine from the federal government, right? Directly from the pharmaceutical, and they delivered to us. We were not told to ask about any insurance status. It was given to anybody who would walk in. Obviously, we focused on the Orange Town, but if you were to go to CVS or Yale, they would not even ask you whether you have insurance or you're Medicare or Medicaid. It was not required. It was all paid for the government, so DPH gave us the specific reasons. That's why we said we have to have a storage capability. We have to have a backup so vaccines not go into waste. If we open a vial, we have to finish it on time so nothing will go into waste. So it was a very meticulous way of administering.
Okay, but why don't you just stick with the documentation, and did you get documentation? of
There
who you
was
gave this?
no requirement to collect the information on the insurance's status. Therefore, there was no requirement by the DPS to bill those insurance companies. We were not required.
Okay, so how did other towns, John, get reimbursed and we did
They
not?
did not.
They did. Griffin Hospital, Yale,
Those are hospital system. I'm talking about the health department, West Haven Health Department, Quinnipiac Valley Health District, Milford.
They did not bill to the federal government to get reimbursed?
Not that I know of.
$40?
Initially, they still are doing it. Now they are billing it because they have the code for billing. They allowed us. They allowed those health departments to get some reimbursement, $20, $30. We only used 2 staffing, and the rest of them were all volunteers. We didn't pay them.
Still, there was a cost to our building, there was a cost to our staff.
I mean, this is for public health services. I mean, we provide services. We are not a profitable organization.
And Dr. Mohammed,
Yes.
I don't want to disagree with you, but I've had people tell me you had 1,800 people that were vaccinated, and probably less than half came from the town of Orange. And I have an email from the finance director at the Orange Visiting Nursing Center that says she has information to collect for less than 100 people. So,
I can tell you this, we followed every single instruction that DPH provided. Otherwise, we would have got it audited,
Okay,
and we
so
would have canceled
We have a period of time at which about 1,800 people,
Yes.
we're not quite sure, there's a disagreement as to all of them from Orange, 90%, 50%. There's a disagreement on whether or not other communities or similar type of organizations such as yours, and we respect the hell out of people who gave their time for zero, okay? We do a lot of that here.
Right.
All right.
We all
So
live in this
understand.
town. We all live in this town. We worry about, yeah, right?
Agreed. But there's some disagreement as to what happened in terms of the documentation. I still myself, and I want to give the other members of the team here I just don't know what problem we're trying to solve. What this does is say, okay, in order to solve this problem, a certain number of sessions or activities, and for each activity you have resources and all that, and it ends up to a number, okay? I'm still trying to get back to the basic, why are we doing this?
I'm giving you a historical perspective, so everybody, who lives in Orange and dedicate their services to
No, I
prosper
think-
for the town would understand where we stand and how do we look for future. I mean, as I shared with the chairman, my job description, this is where my job is, to advise the first selectman, the town's, leadership, where we at and how do we look forward, given the fact that we're still dealing with the pandemic, and what do we anticipate coming in future. I don't want to be standing here and telling you that we have nothing to, do. It would be much easier for me, but I am as vested as all of you are in this
Right.
town,
Right.
And as a part of the citizen, I don't want to ignore the gravity of the situation. I've been working with my team member here. They know I'm proactive. I mean, how it happened before me,
Okay,
I can't
right.
talk about that. But
Right.
to answer your question, this is just a piece of problem that we're trying to solve without burdening our taxpayer. I pay taxes too in this, just like.
Right. But
So
where
the pandemic funding that came through allows us to increase the staffing,
the
allows
American Rescue Plan Act.
the same name that they use the acronym for, Mr. Lee, yeah.
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 Well, let's use
And
the
my-
right name.
Right,
American Rescue Plan Act.
I have to go back and look at.
I looked it up for
Right,
about
the-
2 hours today. I was very careful to try to start to
We-
discipline my brain to do
We
that.
received the fact sheet. Department of Finance was kind enough to send us the fact sheet where those fundings can be used for. And when we discussed with the Board of Health, the Board of Health said that these fundings actually do allow to provide these services, and one piece of the service is the vaccination, including contact tracing, mental health support, education, and the rest. I didn't bring the fact sheet because I was rushing. However, there's a fact sheet that was provided by the Department of Finance, and we reviewed in our Board of Health meeting, and that's the reason why we're trying to understand how can we, inform this body who approves all the funding, so that can go into the public health mission as dictated by, some of the essential functions from the Department of Public Health that we provide our annual report to.
Kevin Moffett, did you say that this got sent to all of us?
I didn't email it yet.
No.
No, that's the
You did
original.
not
The
yet?
original was sent by
Okay.
email.
Okay, okay.
Yeah, this is the revised one. The other one was
Yeah,
almost double.
no, I'm looking for this one. Okay. So let's,
I gotta say, on this one here, and even on the original one, whatever the payroll costs are, there isn't a burden on it for FICA and workman's comp, so that's gonna have to be added to
okay,
whatever we do.
tell you what, whoever is most conversant on this, could you walk me through so that I understand, and we'll just talk, like over coffee?
Sure.
All
we
right.
can hang up
In other
to
words,
give
how
it
many-
all the
how many-
copies. Is there an extra on the table?
Yes, there is, right there, John.
Thanks.
Like, how many weeks, how many sessions, start with that, and then
So
we
it's,
can,
it's a weekly session for
Week-
24 weeks, about 6 months.
a weekly session?
Yes, that's a rough
So it was
estimate,
it like
about weekly.
what's it, okay,
So one
one day a
session
week?
per week.
okay,
Correct.
and how long is the day?
8 hours.
Okay, thank you. So when we see these, is it, okay, per clinics, okay. So what's happening in these 8-hour sessions?
We're administering the vaccine, monitoring the patients after their vaccination for safety.
The same thing as they did over at Yale, you have to sit down for 10 minutes or something like that?
15. Yep.
15? Huh? I snuck out earlier.
Unless you start crying, they will send you quickly, but they have to keep you for 50.
They know you're 5, Jim.
Yeah, okay. So okay, so we see a nurse, so if you have to give somebody else to know what they're doing, to punch it in your arm, right?
Exactly.
Physician, what's going on there?
To make sure that there's no contradiction, because we, based on the DPH guidelines, they have to be monitored for somebody who can prescribe. We would have a backup EMT
Roger
as well,
that.
yeah.
Okay, where are these happening, by the way, John?
We did it in High Plains.
Have you cleared a room at High Plains?
Well, once things are approved, we're gonna go step by step. We will find a schedule, we will
The
find a.
last place we cleared a room at High Plains.
Okay, I mean, I don't have to get,
Town's building, yeah,
Yeah,
town's
okay.
property, nothing.
so what is the admin support doing?
That's exactly what the paperwork would be. As you mentioned, we didn't have those support, so check in, put into the database. When you check in, they look at your identification card, make sure that's James Leahy, date of birth, social security, right?
Okay,
all
tell me
those.
about contact tracing.
So contact tracing is a process that's required for many infectious disease, TB, HSV, to name a few. However, the contact tracing has become more apparent for COVID cases. So any positive COVID cases that would come in town would have to be contacted within 24 hours to ensure that they are provided, proper guidance about.
Dr. Muhammad, when you talked about the different types of COVID, what do you call the original type? I heard you say Delta and Omicron, if I'm saying those.
These are variants, yes, sir.
What was the first one called, or just, in other words, you
we-
put them all COVID, so I want to give the first one a name.
I am not calling anything. This is the CDC classification. So the first strain that came was B11 something. It was started with B. I remember that was
B11, let's just, among
something-
friends,
something
we'll
that-
put
yeah.
quotes around it, that
Right,
way if we're
right,
wrong, we can
yeah.
say, well, it's just, we came close.
Right.
Okay, so we have, the first one was B11, that would seem to be the strongest one.
at that time, yes.
Yep. Delta,
BN1,
right,
I think it was.
Right? Yeah.
right, and now this Omicron.
Most recent one, which is approximately. Right now, we still have Delta. Delta has been circulating since summer. So July, August, September, October, we saw Delta. Now Omicron is becoming the
So
dominant.
Delta's kind of,
Correct. Delta is being replaced by Omicron.
Omicron?
Yeah.
Okay.
Yeah.
And my understanding of Omicron is weaker and most likely more like a cold or a bad cold,
So far.
so far. Now,
among.
to the wrong person, it could cause them their life.
Correct. For vaccinated people, it's causing milder symptoms. So that's why we are still encouraging, because there's still Delta. When you catch COVID-19, you don't know which strain you are catching, unfortunately. There's
Yeah.
nothing different. The symptoms may change, and Brian does the contact tracing for me.
Yeah.
And when we speak to people, they say that those who are vaccinated, there are very few breakthrough infections in our town, which is good because we're 76% fully vaccinated.
Right.
So thank you for all of us who
So-
are improving the
So when
community.
I hear 50 cases from your voice tonight,
Today, yeah, as
what
of
were we getting? B1, Delta, what's our distribution?
they're not checking on every. This is a molecular testing, that's additional testing that the lab does. However, we suspect that majority 50-50, so maybe 50% are Delta and 50% Omicron. That's my guesstimate.
Okay, I'm happy with
So
that.
don't quote me on
without-
that because I don't work for the lab and I have no idea.
No, it doesn't pop up here, a specific answer is
Right.
what you're saying, when you do your initial test. That's what I thought I heard.
That's
you
right.
say. Okay. So contact tracing, so the contact tracing only happens on the one day of the week of?
No, it can happen any day. It can happen any day, but somebody.
So that would be funding for kind of like
Throughout.
a level over the 24 weeks.
Correct. We are doing it somehow to put hours into, some sort of a scheduling, some sort of, budgetary process, because I don't know what other ways to kind of include this, activity in somewhere else.
So John, you're saying that any labor costs of which the 4 items on this sheet would be, there would be an additional cost of some component?
7.65 for FICA and Medicare, and then there'd be another charge for workers' comp.
So let's call it 10%?
Probably 10%.
10%? All right, so there's a plus 10% happening there. And the medical supplies, $500 a session?
Again, a guesstimate. These include syringes, not syringes. These include bandages, gauzes, and other things. Sometimes the state does supply with that, and at
Okay.
times we have had to order, purchase our own. Again, it's all guesstimate.
Okay, and I've heard, okay, so you multiply the 24, we don't have the Excel file, but it sure looks like it's just 24 times that 1,900. That gets you to the next one number? Okay, so tell me about the last number on this page that we're looking at. And unfortunately, we couldn't put it on the screen because we
Right.
don't
So
have it.
the incident management system is not going to be only restricted to health department. I want to clarify. We had a joint meeting with fire marshal, with police chief, myself including, and emergency management. This is the software, I guess, John, they used to have, right? The orange,
Oh,
the VOC?
I think is this something with Jamie Vincent?
Right.
No? It's coming into the budget in the new year. in-
Under his budget?
Under Paul's software budget.
Okay, so we can remove from,
This is a 3-year cost, not a monthly cost.
I think so. This is, again,
It's a 3-year cost, Jim, so
So
you can
you're-
take that out of there.
Okay, so
There's a
this is
small-
not part of your request.
there is a one module for COVID clinic to
It's some kind of software that
It is.
helps all the different departments.
Incident command.
And it was something they had
Exactly.
years ago that for
Exactly.
some reason went away.
Fire,
we have
fire
put it-
uses it, dispatch.
Yeah, we
fire
have put it
dispatch
in the
includes.
budget.
where the roads work are happening, where the closure is. It's a software, it's an electronic system, and they have developed what's called a COVID module that will be applicable to what we will be using it for that reason. But it's a one big package software that has all the options.
John, we've had a number of sessions with other organizations in the town of Orange having to do with health. OVNA may have been one of them, right? How is this not all consolidated, I guess?
Well, the OVNA, as you heard, we're only one of 3 towns in the state that still have a OVNA.
Well, I'm talking about our town. We're trying to do something, right? We're doing something for our residents, right? For which there would be a cost, and this is a significant cost, in my judgment. Given that you can go other places to get the very same service, okay? And I'm very, Omicron has the type of low impact compared to, what do we call it, Dr. B11,
B1157
Yeah,
maybe?
yeah. And it spreads kind of like wildfire. You know, the NBA and all these other sports teams are finding out about it too. Very healthy people, they take a test, you give them enough tests, they test positive. Oh, you can't play the next day. And now all of a sudden we have a created problem, right? Almost because we did too much testing in these athletes. I mean, I think that's why they're changing the rules in the NFL, for example.
If your question is, why can't the OVNA do some of this?
Yeah,
They don't have the time and the resources.
That's right.
to
That's
put it
correct.
to
They are
this.
part of our Board of Health, but they're,
That's why they only had one person, I think it was, when you did it before, because they just couldn't do it with their patient workload and all
okay.
over there.
And we don't want to burden them.
And Brian did the contract tracing, and he tried to use school nurses, I believe, right over the summer.
Yeah.
And he tried to make do with that also. We
Okay.
tried to use different pieces that we could at the time.
All right. Kevin, I feel like you're dying to ask you a question.
Now, the one question I had is, you said this is a 6-month program. Would you be doing it by reservation or walk-in or both? I'm sorry.
Both.
Both.
I think we have to maximize the accessibility to residents, and a public health nurse would help schedule these, clinics, would inform them, and if these are walk-in, we would welcome any person who would walk in and wanted to get booster or their second series or third series, whatever that may be.
Okay.
Yep, good question.
I guess as part of that question, at some point in time during the course of the 6 months, and as you are setting up reservations, if your enrollment, let's say, was very weak, would you then cut back, or do we have to put these people on a contract to bring them in to do this kind of work?
So this is exactly what we were thinking. If our vaccination clinics are slow, we would have to utilize that same personnel in doing other activities, as I said, contact tracing, doing the disease surveillance. There are a multitude of activities that we have to be performing, which has not been performed, and that's why we were notified by DPH not doing it. So we will make sure that, given that time, and again, I'm very fiscally conservative myself, so we would have to calibrate how we go. That's why this is the 6th month. We will be more than happy to come back again in 6 months to reassess and where we stand. But this is based on our previous experience and based on the activities that are mandatory for us to do. This is a very conservative equation that we have brought, in front of you. I don't know all the answers, but when we collect the data, we will have better answers to look upon.
Yeah, I think this whole thing, the whole COVID-19 thing, we're in unexplored territory because we're
Yeah,
first time
that's
through
why
with so much of
I
it.
mean-
So I think it's
Exactly.
caught everybody kind of, inquiring minds want to know, I guess is the, but thank you.
My pleasure. Yeah. No, I think
Yep.
we all are learning on a daily basis.
Okay, I want to get the sense of the team here.
Yeah, so I get the sense that you're here tonight because you're considered the lead agency for this town as the Department of Public Health. And the Department of Public Health from the
Jeff.
state level, the Department of Public Health from the state level did come out and make each town and city the lead in tracking all this information, tracking this data.
Yes, sir.
1,800 vaccinations is what, 15% of our population, roughly?
But remember, at that time, there were only people who were authorized to 18 and above. First, we
True.
started with 75. We brought it down to 65. And then, so at that time, after May, there were other clinics available in the community, and we didn't have support to carry on because volunteers are not going to spend their summer with me vaccinating, no matter what. And then OVNA got busier as well. So we didn't have any coverage. If that was the case, I would have offered one or once a week or, as long as I could.
Yeah, and what's the significance of the 6-month timing?
From the
Because ARP, I mean, as you know, ARP funds don't expire until December of 2024. I mean, I'm hoping that this pandemic isn't gonna go on now.
Yeah, we hope so too.
All of us,
Yeah,
But I mean,
that's for
Well,
sure.
Yeah, and I understand that, but, you know, it's also, you know, there's money available, and all of a sudden people show up. No offense to anybody in this room. But let's make sure we go around. Joey, you want to weigh in your thoughts as
I mean, one of my questions, is the federal government sponsoring all of these vaccines?
who's paying for the vaccine
Yeah,
itself?
is the federal government sponsoring all of these?
Who's paying for the
drugs?
vaccine?
DPH, state.
Yeah, state, through the federal,
Through
funding.
federal, yep, through that channel, yeah. All the vaccines that are made are pretty much free of cost for the population, yeah.
Yeah.
We have to get the, you know, syringes or other things for our administration purposes, and that's the reason why I was trying to tell Mr. Lee that after a few months, when AMA came up with the CPT code for billing, it was allowed, but we were not told to collect any information. Some healthcare systems did that because they have paid staff. We didn't have any, you know, person working for us for that reason. It was just me, myself as a staff, and my colleague from OVNA. We're already paid. We're not getting, you know, double dipping for that matter for providing our services. It was only allowed after certain times when private sector kicked in. When private sector, CVS, they're not going to do it for free. You go get your flu shot from CVS, they're going to need your healthcare insurance, right? And they charge $40, $50, depending on their mutual contract. We were not allowed to do that from DPH because
What's happening on the path forward?
Sorry?
What is happening on the path forward? Say we agree to
Path forward?
all or part of this, all right? What data would be collected?
So we would collect, you know, how many contact tracings we have performed, how many vaccines we're giving, what type, you know, what age group. We already are doing in our, you know, limited capacity anyway, but we would be able to do it and
Would you
fulfill.
restrict it to only to Orange residents?
Well, I would focus on Orange first, and if somebody is visiting your, you know, your household and unvaccinated, and you come, I will give them the vaccine.
Would this ability, if I was working in Orange, would I?
Correct, yes. Yes, you will be eligible if you work in Orange. We wanted to reach out to our business partners, and we worked very closely with our business partners, and we did get them the vaccine, quite frankly. Some of the essential, those who utilized us, they were also business, you know, corporations, industries. As I said, if I had more staffing, I would have gone to their, you know, areas. Say we have big factories, manufacturing, we would have gone there and give them all those things that we do at the hospital. This is what we do at the hospital anyways.
Yeah, I
Wouldn't be a
understand that,
problem.
but I thought you were Orange-based.
We are. When you say to businesses, I said yes. We would be able to give to the businesses who are situated or located in Orange. I
Okay.
think that's what I understood from your question.
And John, would this be reimbursable in the same way that you were discussing last time about reimbursement?
Well, if you give them any money, this is coming out of the American Rescue Plan funds.
No, I'm talking about reimbursement from the
You mean
government.
the shots?
Yeah, in other
Actual
words,
give them the-
we had a
bill the-
disagreement
We
earlier.
bill the insurance of the people that go to
Well,
the
you
clinic.
never bill the insurance because it's free, the insurance. It's through the federal government that you get the reimbursement from. That's where all the people, a lot of the people getting the shots, when they try to contact them, the VNA, they try to contact some of the people, get the information. The people weren't giving it to them because they said the shots were free. Well, they are free, but to get the information you need to get to them, to get to the government, to refund the $30 or $40, you needed that information.
Okay, are we going to collect that information?
If somebody is insured,
We got the administrative support
right,
as a line item, right?
we can. Now we're allowed to do that.
If we want to get reimbursed, we have to collect the information.
Correct.
We gotta collect the data.
So
Right.
previously, we did not collect the information, so we were not reimbursed for the funding.
We were not allowed to do that.
40,000-ish that we lost.
Right.
That was lost.
Well, I wouldn't say loss, we were not allowed to do that.
Not allowed.
Yeah.
Okay.
I mean, I want to be clear that it
Okay.
wasn't that we were ignoring that piece. It was not on the DPH guidelines to do it while we are working under their authority, under their authority. I could not get any vaccine from anywhere. Those DPH were the source of, they would ship the vaccine 2 days before our clinic. So they wouldn't get expired. So there were strict rules that we had to follow. In fact, when I was collecting our vaccines from Quinnipiac Valley Health District in North Haven, I had to be escorted with one of the police officer. They were following me because we were told to be under strict, security. So those were the
Okay.
strict guidelines from DPH.
Got it, got it. So we could collect data for which we have the potential get reimbursed money for each
Correct.
for each person that goes into this clinic were we to approve this. Is that correct?
Correct. We would
And
have the
could-
administrative
We
support.
could
to
work
do
it
that.
out between you guys and our
Yeah.
administration? No.
No, it's got to go through the OVNA. That's
OVNA.
where- That's where they
Is there
do.
anybody from OVNA here? Can you educate us in what you know? Come on up and sit at the table. It's all good. Turn on the microphone for this young lady here. Please.
Sorry. So my understanding for billing is, the billing is for the actual service that we're providing to inject the vaccine into that person.
It's called placement, for the placement of vaccine.
All right, but as long as I see you two head nod, I don't need to know every detail here, right?
Yeah, and then our biller at the OVNA gets that information, and then she then turns and does the billing for those people. But my concern is, depending on the volume, how much she's going to be able to fit in her 8-hour day.
No, roger that.
Yeah.
Okay, we haven't even gotten to that, but it sounds
Right.
like they're doing this once a week for 8 hours.
So
Okay.
depending on how many
How
people
many
you
people,
get.
it'd be how many? If you got 500 a day, that'd be one thing.
Right.
You don't have to bill on day one.
No, we're talking just
Right.
volume here.
Yeah.
All right. But if we had the good fortune of 500 a day, you would feel better about,
I would.
all right. At whatever rate we're being reimbursed, we should be able to, I won't say a profit, but we should be able to cover costs here. Maybe have
Right,
a
some of the
smidge
costs.
left over, as my
Yeah.
mom used to say. All right, is that what I'm hearing?
Yeah, that's correct. If we are able to, now we're allowed, we can collect that information, we
Now,
can process and then bill it.
We would work together in making sure that you would define the information that's required to be able to input it in your
Yeah.
system.
Right, our
So
biller
that
would.
you
The
guys will
administrative,
have,
yeah.
you won't have to, you have to be a template. We'll create something in Excel.
course.
And put it on the person, you want this service from us today? You must fill this out. Simple as that.
Correct.
The answer to your question is if you don't, then you're not getting the service today.
That's right.
And we could agree to those rules.
Well, now, let me just clarify. We cannot deny somebody who does not have insurance the vaccine. We still have to give the vaccine. Insurance,
Because it's
not
being
in,
provided by the
yeah.
government.
Okay, but I
So
thought
if you
this
have your
was-
private insurance or Medicare, we can get the
Okay.
reimbursement.
But what percentage of the people would that be? I'm curious. I mean,
From the first round of clinics, I don't think there were
Not to
more
worry
than a
about it.
handful.
And we're not gonna, we're not gonna,
Yeah, almost everybody, I
cover
would
it.
say, that came to the clinics
Yeah.
initially had insurance that
Right.
would now be able to be
Kevin,
billed for
how
them.
about-
We weren't
Free-
collecting
free
that
month
information
trial.
because we were not told to. Simple as that from DPH.
and then come back, tell us how you're doing.
Let me, before we go on, let me make sure everybody knows Lisa Clemento was the director of our OVNA.
Yeah, the administrator of the OVA.
Thank you for coming tonight. I don't know
No
if you just had nothing else to do or whatever. Here's what I would like to do myself, but I don't know what to throw it. I'd like to do this for 3 months as a pilot program. Prove the concept, okay? And if it's working and it's a good deal, all right, then we can talk about how much we can extend it.
So I cannot hire a person to say that you can only work in here for 3, the public health nurse that we need
Yep.
to include. We need to have an year-long project, but we can supply the result or the data every 3 months, every 4
Well, my proposal is I'm proposing a pilot program to fund this for 3 months. Come back here in come back here in January, February,
Yeah.
third week of March, so you're not even through your 3 months. Show us the data, all right? Show us what you've been doing,
Yeah.
right? You'll have had 10, 11 weeks of
Yeah, if we are
You'll
not
have
gi-
some startup issues, obviously.
Of course.
All right, but just tell us how it's going.
Absolutely, no
I
problem.
don't know, I'm not, am I springing a quick one, a curveball to you guys?
So-
I mean, I'm just giving up the idea here.
So just to clarify, yeah, so all these activities that I mentioned, if we're not giving the vaccine, we're doing the contact tracing. If we're not doing the contact tracing, we're giving the vaccine. So all those things
Well,
are part of, yeah.
Yeah.
Everything.
Come back and tell us what you've done.
Sure.
Right?
Absolutely, I
you
can
know?
give you the
But I
data.
think the major thing that we're looking for is the
Staffing.
vaccine
Well-
for the townspeople.
He needs the staffing. I think
Staffing to
that's
do the
rub here.
vaccine,
That's right.
right? So,
You need this, what I'm saying
Right.
is that rather than multiplying this by 12, Kathy, is, excuse me, 24, multiply it by 12. So if that turns out to be 22,886, I think, if I did half of it, that's the idea I came up with. Kev, what do you think?
Is that doable?
absolutely, we have to do it. If we don't do it, then we're not doing.
It gets
as
you
I said.
started. Prove
Well-
the concept.
The concept is already proven, we have to implement it. I mean, I've done.
Well, okay.
You know, with the 18.
Yeah, but, you know, implement it, okay, concept implementation.
Yeah, right.
Prove the concept of initial implementation then.
And I think, to Jim's point, what'll probably make the program successful, how do you guys plan to market or tell people that this clinic is available?
Yeah, I mean, what we did was, we have to utilize local newspaper, our website, newsletter. You know, we do have a little bit of funding that from the last fiscal budget to, update our webpage for the health department.
Yep.
So we have to employ all those type of activity. I write in local newspaper, try to educate our, citizens to, to be up and ready about
John.
what's coming next.
What
Sure.
about the button on the town homepage? Remember I did that for the fire association and then you did it for a lot of different things?
Yeah.
Maybe we could, because that's, hell, I could go home and design something now.
That was there for a while.
Yeah.
wasn't it?
It was on the.
You know the button up there and the
Yeah, yeah,
left?
of course.
It was there for them for a while on the last thing.
Yeah.
It was there.
Okay,
Under-
so
under the
let's
guidance-
review the bidding and make sure we got this right, all right? Pilot program for 3 months, which would be at the cost of, let's see, 22, somebody, quick, who's got the thing there? 896, is that it, Kevin?
22.4, yeah.
And then you're gonna wanna increase it by 10%.
And then increase it by 10%? All right, so we're funding, for our point of
Make it
view,
a
it's about
round number.
25,000?
Make it a round number.
Yeah, 25,000.
25.2.
All right, let's just make sure we got it right. I hate to be wrong.
25,185, 60.
Are you gonna be able to get it up and running for that?
I will try my best. I need personnel to help me out. I just need people to, march my orders. That's it.
Yeah, and then multiply.
As I said, if we're not giving the vaccine, which we will be when we start
25.2, John.
Just make it 25.
Make it 25, you
25.
can say. Yeah,
Okay.
25.
All right, so I want to make a,
One other, hold it, one other second. Lisa, you remember what your nurses get? They're all different rates, right?
Yeah, they're different rates, but the in-service and basically the hourly rate is 30 an hour for OVNA for any kind of training.
But this is actually administration, so this will be like a clinical rate,
What would that
not
be?
the in-service.
So
We got
we
38
have
there.
We have 38. Can we do like similar to what school nurses?
Now, is that for the public health nurse role, right? So
Right.
she'll be doing the injections as well as helping with
Education,
contact
right.
training, education?
Right. I thought that was reasonable, given talking to your nurses and other school nurses.
Yeah, most nursing positions run around 40 an hour,
Okay, so we can do
really.
40 then?
So I think 38 is
Oh, 38
pretty
is-
That's pretty
on
reasonable.
target, yeah.
At least 38.
Okay, at the moment, like I said, I don't know for sure. We will just average it out and we'll come back with 3 months and see what the rates are.
Now, everybody you hire has got to do the town paperwork too, so if you call Audrey will get you that,
Okay.
and the application and all that stuff.
Well, I will need some guidance, of course. Thank you.
okay, let's review what we said here. 3-month pilot program, I got, half of that number, Kathy, I think is 22,890. Christie, violation on me. It's not the first one today.
Times 2, that's a double minus.
Plus 10% for John for his big there. And so that's about 25,000 that we would be approving if everybody likes this proposal, but it has some stipulations. That you would come back in our March meeting. That gives you a little under 3 months, and if it's April, we'll do that whenever, or whatever.
Well, I hope that I would be able to hire somebody to launch the program. Remember, I'm looking.
Well, okay, you can, and keep in touch
I will-
with John,
yeah.
you know?
I will
If we're
definitely,
gonna work as a team, let's work as a team, right?
absolutely, this is for the
Now,
town.
here's some other things that is important to me, and I think this team.
Sure.
I want your team, so I don't know if to say you, Dr. Muhammad, or
Christie,
Christie, I'm gonna,
we have Brian
Christie.
and Lisa,
All
yeah.
right, we'll write that
They all are
down.
my team.
To work with
Lisa.
Lisa.
We already
All right.
work together. I mean, they're.
Yeah, but I'm gonna define what you're gonna work on.
Uh-huh.
All right, to create a template for each vaccine recipient to fill out. In other words, I don't wanna say, oh, I thought I knew. No, no.
No.
You sit together for 20 minutes and say, okay, these are the 17 fields you gotta fill in, or however you do it, make sure it's electronic. all right?
Consider it done. We already
Yeah.
have that, yeah.
Okay, good, but you gotta make sure that it's the one that she
I'll-
needs in order to get the reimbursement rolling.
I will make sure. I
Okay,
can
good.
assure you that.
All right, so we're gonna do that. And the money would come out of the American Rescue Plan Act, ARPA, which I think I have on the screen here, slide somewhere.
We don't need that.
Here we do. Because this is what we're gonna be doing, right?
Yep.
Something that looks like this. This is a
Right.
version 1, I created it today. Probably as I was calling people by the wrong name like I did in this meeting just now. Because apologize. So anyway, we'll be floating that in with this $25,000 that if we approve it as a team. Any other stipulations that we want to have on it to make sure we're organized and tight in this?
Tim, you just need to make that all part of a motion.
Okay, I'll make a motion for a 3-month pilot program for the COVID-19 vaccination clinics. Is that fair? That was your
I would say
title over here.
COVID-19 pandemic,
I'm just reading from your sheet here.
right, COVID-19 pandemic mitigation plan.
I'm sorry?
COVID-19 pandemic mitigation plan. That includes
Mitigation.
mitigation.
Yeah, COVID-19 mitigation
The
plan.
top line is mitigation expenses, that's what we're gonna stick
Okay,
to.
thank, oh, I was reading from the wrong line.
It's
Doctor.
all right.
Thank you
No
for your
worries.
patience. All right, so 3-month pilot program. Secondly, that they would come back approximately in March to review with them the status of, and just lay it out, what you've done.
Will do.
You know? And you'll work, Christie will work with Lisa, or Dr. Muhammad will work with Lisa, the VNA director, to create a template to document information for each vaccine recipient. And I think we're also saying, Lisa, but I don't want to put words in your mouth, so let me field this that before it becomes part of the motion. You will then, on a periodic basis, submit this stuff, this information, to the proper source for potential reimbursement?
Right, once we get the information that we need, then our biller, Anna, would then bill the insurance company and receive those funds.
Okay, so you'll take the responsibility to do that.
Mm-hmm.
So play back to me what me and Deb will write down. OVNA leadership will do what?
Receive required information
Yes?
for insurance billing,
Yeah. To submit the information to insurance building, is that right?
to insurance company,
To
and then we'll have to somehow create a line. We'll have to work with.
Submit
Yeah, we'll work
information.
with John to create on how we're gonna submit that information.
To ensure
To
it
him.
for reimbursement to the town?
Mm-hmm,
Okay,
correct.
okay.
Which will then help their problem over there, just so we all know that.
So how quickly can you get up and running?
Yesterday. I have to wait until I get somebody and I will work with Lisa. This is what we were planning initially. Before even coming here, we had a discussion, say, look, we want to find somebody who can dedicate some amount of time,
Yeah, you're doing 12 weeks now, right, instead of 24?
we hope so, yeah, I mean, more or less.
And if it's good, we extend it, and
Yeah.
especially the kids or whoever's,
Yeah.
Whatever.
see
Right,
what the
exactly,
future
exactly.
holds.
So
And
Deb, will you
if
mind?
after week 6, you have one person a week, then, okay.
But we'll still be doing, so what I meant was the mitigation activities include, I will provide all the data on how many cases we perform the contact tracing with, school
You don't have to-
system.
You don't have to define it now.
Yep.
I just want to make sure that you.
We got to get a lot done here, so
Okay.
would you play back the motion, Deb, for us, or?
Says the guy who's doing all the talking.
To approve $25,000 for a 3-month pilot program for the COVID-19 mitigation expense plan, with the stipulation that the Orange Board of Health come back to present data at the March meeting and to work with Lisa to create a template for vaccine recipients for proper reimbursement to bill the insurance companies, and then with John to reimburse the town.
Well, that's the same thing, you can cross that.
Okay. Got it.
Yeah.
But you forgot the most important thing.
What was
For
that?
funds to be allocated from the American Rescue.
Okay,
Yeah.
all that, yeah, happy,
Yeah,
yep, yep, got it.
Okay,
Yep,
so I made a motion, so
Okay, so there's a motion from Jim. Is there a second?
I'll second the motion.
Second by Kevin. Is there any further discussion? Once, twice, three times. All those in favor?
Aye.
Aye. Opposed, abstained, unanimous. Thank you.
sorry
Thank you.
about that, team.
Thank you for the opportunity.
Thanks for
Sorry
your time.
the like.
Thank you for your support. You bet.
Okay. 4B, memo from Kathy Charbonneau, Executive Director, Orange Chamber of Commerce, requesting funding.
He's apologizing now.
What's that?
Apologizing to him now.
Welcome.
Hi, thank you.
Good evening.
Say, I told
You were
I didn't think it would be that long.
Hey, it's a good service. It's a good decision. So I'm Ted Novicki. I am the president of the Orange Chamber, resident, work here in town. We are before you here today, just like the last time, to request funding. Now you're all thinking, wait a minute, you've never been here before to request funding. Correct, we haven't. So we've just sat and listened to a whole lot of information and review surrounding the pandemic, its different impacts. We had recently reached out to First Selectman Zioli to talk about the potential for some assistance as we kind of reinvigorate following having shut down during the pandemic. Jim, First Selectman Zioli, did mention this funding source, which we have since found out would not be appropriate in this instant. Doesn't change the fact that we're still here requesting funding. We're requesting $10,000. We're looking to update our IT infrastructure, which is really crucial, I would say, to promoting business. Obviously, a lot of folks are utilizing the internet, email, for those types of promotions. And realistically, we need more hours to actually recapture some of the membership that lost either through going out of business or just having to make difficult decisions, which, quite frankly, I can understand during the pandemic. So our request really is for the additional money to bring someone in part-time or extend Kathy's hours. Presently, Kathy, our executive director, who is here, is part-time. Most chambers do have at least one or more full-time staff. Ultimately, over the course of the pandemic, we did have to shutter. We did have some fixed costs. The former executive director decided to retire, so a lot of that fell on me. So when I heard you guys talking about spending time working for free, I appreciate and applaud your efforts, as I've found myself in that same boat fairly often. I'm sure there are going to be questions, so I'm happy to answer it. I would like to introduce, though, Kathy Charbonneau, who can provide a little more information. And some of the changes, I would consider them pretty fundamental, that we have instituted at the Chamber to really right the ship and get ourselves back into the correct direction.
Because right now, the Chamber's, you're your own 501c3.
correct?
No.
No.
501.
It's C3 something, it's not, we're not considered a nonprofit, and we can't avail ourselves of any of the funding sources that nonprofits would get. It's a weird hybrid.
That's why, Kevin, originally, they asked for the money out of the American Rescue Act, and we thought it was okay. I went to a seminar put on by Scrog 2 weeks ago, and the specific question was asked by another town, and that was the most definitive no we got in the 2-hour meeting, that because of their status, that we can't give them that money.
If
through
they
that.
were a nonprofit, they would be able to do it.
Right.
Yes.
So you're
kinda
tax
in the-
exempt, but not nonprofit.
Right.
You get all the luster, none of the value. No. I'm kidding.
So what's the difference, I'm looking at, and I put up on the screen here.
Sure.
Chamber and Orange Economic Development Corporation.
Great, correct. So our mission statement is to assist and promote local business. We're also and one of the great actions that Kathy has really undertaken is also interweaving the community in, as well as other not-for-profits operating in the
Tell
town.
me what the chamber does again. You just used words, and I would like to hear those again.
We
if you don't-
support and promote local business.
Okay, so
And the Orange
promote
Economic,
local business in what ways, Ted?
We provide resources for local businesses. Now, some of the things that we're talking about that I've already started is, for example, the Shop Local Club. That is a card that we created. They've been distributed to 1,500 people to date. It started, I would say, in early September. Basically, trying to connect community members with businesses. I talk to local businesses. I try to stick with the chamber members, but that has been dwindling. And I get them to agree to make a special offer that's only good for Shop Local Club members. So then when the residents have the card, they know that they're going to get the best offer from that business, and it helps drive community members to the local business. I'm trying to create programs like this that connect the community directly with the local businesses to help them. Another thing is putting together an intern program. A lot of our members are, small to medium-sized businesses. A lot of things that are going on right now is on social media, and it's very important to have a presence and knowledge of social media. And the smaller and medium-sized businesses, they don't really have the time or expertise to be able to utilize it as effectively as possible. I mean, for example, I'm not an expert in social media, but I've been promoting the Bicentennial Brick Program. I don't know if you guys have heard of that. We're selling bricks for around the gazebo in conjunction with the Bicentennial. I spend around $15 a week, and I've been able, during a 3-month period since it kicked off, to generate $1,000 of brick sales just by spending $20 on the Facebook advertising. And that's only scratching, the surface of what could be done. So we're trying to build value for our members by providing these kind of resources for them.
Okay, are you guys, we've got a bicentennial committee, right? Are you guys integrated with that?
I was told that I was going to be, but they had their first meeting, and I don't know if they have a core group that they're starting with.
Who's in charge of this? Bicentennial?
Pat O'Sullivan
Pat O'Sullivan,
is the
yeah.
chairman.
But no one had reached out to me at this point, so, I mean, it is something I was going to pursue.
Okay, Pat O'Sullivan. He
Okay.
works upstairs.
Right.
Just-
Not anymore.
No, he's out.
I thought it was the first of the year.
No, he's still there.
Oh, he is?
Till January 1st.
Oh,
Yeah, I
my
mean,
bad,
you know.
sorry. I thought he had
Next
retired
coffee
and moved
break.
on.
Right at the end of the hall,
His-
first floor.
The town
If you're-
clerk's
if you
not
got
Right,
it, I
again,
can give
I
you my
mean-
phone, I'll go with you.
January 1.
No, I do, we absolutely want to be involved in that, and we have activities planned as far as the Bicentennial Bricks. We're going to be having a groundbreaking
Right.
at the beginning of the Bicentennial, where we're going to invite business businesses to come and have tables. We're going to make a big event out of it, so.
Oh, okay.
And then we're going to have, once it's installed, we're going to have a dedication. And again, try to use these opportunities to also allow businesses to connect with the community during these events.
Well, a couple of things. It always been kind of amazing to me that there's an awful lot of overlap between the Chamber and the Orange Economic Development Company.
Totally
I
agree.
guess you could also say that, Ted, given your words, support local businesses, the Chamber might more have a flavor of helping businesses that are currently here.
That is
expand,
exactly it.
Versus Orange Economic Development might be more getting new businesses here. I mean, there's an overlap for sure. Venn diagram, very big overlap. But I could see that. I could also see where there might be some integration stuff there. When you say you're declining membership, how many members do you have?
I would say we have approximately 100, but here's the problem with me giving you these generalized figures. I came in May expecting to have some kind of operations overview, some sort of manual saying what we have. I came in, I have 1 page of accounts and passwords and 3 handwritten pages of cryptic notes. And that's what I inherited from the Chamber. The way I find out about things is if there's a fire that starts, I'd identified right off the bat that we were paying $1,500 a year for merchant services, which is the ability to take credit cards.
Yep.
And we took we processed 4 credit cards and we're paying $1,500. It was so convoluted the way it was set up. And then we found out they had a second account. So we were paying for 2 accounts. So I'm continuously finding these things out as I go along, trying to put out fires while trying to create value for our members and move the Chamber forward. On 20 hours a week, which I don't work 20 hours a week, I work more like 25 to 28 hours a week, and I could even work more. But I didn't take this job for the money. I took it because I grew up in Orange, and I wanted to give back, and my dad was the town assessor for 30 years, and I felt like I wanted to carry on his legacy. So I'm willing to make this investment because I believe we're gaining traction, and I'm getting a lot of positive feedback, and I'm trying to include nonprofit organizations and community organizations. With the bicentennial bricks, I created this program, Bucks for Bricks, where the local nonprofits, all they have to do is put some things out on social media, send out an e-blast, and they will get $5 credit for each brick that they sell, and then whoever sells the most bricks will get a donation of $500 on top of it, just because I know that they're struggling too, and I just feel if we all can work together that we're all going to be better off, and those are the kind of things that I'm trying to create for the Chamber, but it's an uphill battle with what was left, and I can't go back and figure out what happened. All I can do is try to move forward.
I understand that. Ted, you've been involved with the Chamber for how long? Probably a long time.
Now about 4 years.
Oh, really?
Yeah.
What's your business related?
I work for Avangrid.
I'm sorry?
Avangrid.
Oh, really?
Owns UI and
Oh,
yep.
oh, okay.
Yeah.
Good.
For full disclosure, Jim, Ted has been very helpful to the town in a lot of energy projects and lighting in the town.
Good.
With UI, just so you know that.
What do you do with Avant? What's your...
So I manage the key accounts department in Connecticut as well as up in Maine. So for example, what does that entail? I don't know. Say like a college like Bates, say,
Yeah.
would be managed. It would have an account manager.
I went to Bates, you know.
I know that. I went to Connecticut College. I won't hold that against you. So
We ran against each other.
Oh, you were a runner, huh?
Yeah.
I kind of am now, but the knees. So.
No, I hear you.
So I do work with a lot of large commercial and industrial manufacturers, large customers, which has really benefit the Chamber in that I've been able to get larger businesses. Like, for example, when Bigelow came into town, I know Cindy Bigelow, so I was able to set up what ended up becoming a pretty big press conference.
How does the Orange Chamber generate revenue? I'm reading here, develop its income-generating programs and events.
So largely through membership, also sponsorship. I can speak very personally that
Yeah.
I know my corporation has been a tremendous contributor in the past. So we're largely through member donation. We have run events though as well, and I think kind of what Kathy was kind of getting at is we're really trimming down, making a leaner, meaner chamber. So I got thrust into this president's position on around late December, January 2019, 2020.
Okay.
Wasn't planning on coming in. On a good week, 60 plus hours with the office, and I travel a lot because I have to go to Maine. So I wasn't really prepared. I got thrust into the president's role, and within 2 months, and in fact, the week that everything shut down, I had set up an event at Grassy Hill where David Lehman, the Director of Economic Development for the state of Connecticut, was going to be coming here to be speaking to members, which obviously, we talk about value creation. So I did kind of inherit a lot that I didn't really know I was stepping into, and I really hadn't been an executive in the chamber until really a few months prior, prior summer. So a lot very fast, but as Kathy said, we have been able to meticulously begin to look at things and find opportunities for savings that I think will allow us to have a pretty bright future. I do see simple things that maybe someone that maybe hadn't really kind of maybe been in business, and I think that's what Kathy has brought to us, maybe didn't pick up on, like our website costs $275 to keep it running per month. That's a fixed cost. We're no longer on that contract. That is a terrible, terrible deal. We should be paying 1/8 of that. Simple things like this that, once I had brought in a business-minded person, which I will say I'm very thankful to have Kathy, because as she does make very good point, I don't pay very well. I'm gotta call the spade the spade. I mean, there's only so much money, but I think with what we've had, we've really made do, and we've made some great improvements. When I talk about the need for new IT equipment, we don't even have a webcam on the. Not that you can't just buy a small one, but the computer we have, I mean, it's got to be over 10 years old. It's just not very good.
It's a Windows 7 operating system running Windows 10. And I don't know if you guys remember a couple weeks ago when a truck hit a pole that knocked out the data and all the computers in this area. It took me a week to get back up again, utilizing two really very intelligent IT specialists. They couldn't figure out the whole thing and how it was configured.
We sent our people.
Yes, the town was gracious.
They had to help her, and
Josh
the first thing they told her was she needs a new computer. He said it was over.
So
$100 up at Best Buy.
with this, it's very atypical for a municipality to fund a chamber. I don't know if it's done at all.
It is done. It is.
So that's a concern. But the other, my question is, all right, you have a request for 10,000. Is that to get you on your feet, or are you going to be here next year, the year after, looking for 10,
No, this is
12, 14?
This is a one-time ask, and that would be our commitment. Is we're not coming back.
No.
If we were, you got it recorded.
I feel like I have all these plates spinning, and I'm trying to make progress, and it's like I just can keep them spinning, but I can't move forward because, I can only do so much as one person working the amount of time that I work. And, as I said, we're getting such great response from the public, and I don't even have time to exploit a lot of the opportunities. Like you were saying about the Bicentennial Committee. Well, I would love to be there, and I would have been there first in line, but I don't have time. I know what I'm doing for the Bicentennial, and I would love to devote my time to the committee, but I can't. I have to focus on the chamber.
Whoa, let's stop right there. You know what you're going to be doing for the Bicentennial.
As far as the chamber goes. with the bicentennial
I would think
bricks.
that whatever the chamber is doing for the bicentennial is fully integrated. Now, again, this is just
It
me.
is, no, it is. But what I'm saying was I
Well,
didn't,
hold up, but you said you weren't at the first meeting.
because I was not invited to it.
Okay, but hear me out. Here's what I'm hearing. Again, I'm just going by what I.
That's fine.
We're going to do things for the bicentennial. We've got a bicentennial committee. I know they're doing something for the bicentennial. My brain says all things should be integrated for one
Right.
bicentennial celebration, week-long event, whatever happens, I don't know. I don't
Exactly.
think it's defined yet.
No, I agree, I
Okay.
totally agree with you, that was
So,
always the plan.
As a future event, you're telling me it's gonna be integrated, great, and the
Yes.
chamber will be involved. But I thought I heard you say, we already know what we wanna do for the bicentennial.
We-
I just
we-
know
That's
as
what
far
their
as
group
the
wants to
chamber
do. It's
goes.
got, the rest of the, is gonna be, there's gonna be events.
As far as the chamber goes. So, again, I was under the impression that the committee got together because whoever chose the key players, I was told that the chamber was going to be part of the committee. And I always have plans to integrate with the committee, but it's early right now, so I didn't push it for the first meeting.
Well,
But believe me, my whole process is to integrate with as many town departments and town organizations and entities as possible. That's something that I think is critical, and that's something that I've built my career on, is facilitating those kind of relationships.
okay. Well, I think the Bicentennial Committee and the Orange Economic Development Corporation would be two. And I think what you've done in terms of finding, it sounded like low-hanging fruit, but significant amount of dollars from what I heard you say. You
Well,
know,
but it's only
the
short.
website, the credit cards, whatever's going on there,
yeah.
you're saving a fair amount of change right there. For
Yep.
the size of the organization, right? That's impressive. So,
Here's the problem with the OEDC. I work in the same office area as Anne Marie, and I've talked to her, because I do believe we would be better together in some way, but if their role is to bring in businesses to the town, they're doing a lot of the things that the chamber would typically be doing to raise money. So that's why, I don't want to go head to head with them and say, oh, the chamber should be doing that. So I try to find other areas where I think we can generate income and help businesses, so we don't go head to head. But, I do a ribbon cutting, and, somebody from the OEDC is there trying to sell an ad to the magazine when I'm trying to get them to become a member, And so it's constantly trying to get the same, dollars from the same piece of pie. And, we should, and, we get along and we try to work cooperatively, but, they're doing their own thing, and, they do a lot of events, and again, they take a lot of sponsorship dollars that would typically, when you're saying typically how chambers get funded, well, typically that's how a chamber would get funded. But I can't go up against, I don't feel that I can go up against them. They're established, they've been doing it for a while, and I don't want an adversarial relationship with them.
So I think, that, back to your point of what are these revenue generating activities? We've been looking at newer things. So we had historically always done the Cinco de Mayo road race, right? It's very similar to a golf tournament, though, where, yes, you can generate a lot of income, half of which you then pay, if not more, to someone else. So we have been looking at newer, different types
Well,
of
the
events.
last Cinco de Mayo race that was done, they did gross 13,000, but they netted like 4,000. And to me, that's a lot of time and effort going into something where I can make a phone call and, try to, generate through, meeting with some of the larger businesses in the area and getting them to sponsor some of our programs. I've had to learn to work smarter and more efficiently because, I've done events my entire life and I'm very good at them, but they're a time suck. There's a lot of moving parts involved with them, and to me, that's right now not the most efficient way to make money unless there's a specific strategy for the event to do that.
Let me say one thing. I sat in the New Haven Chamber for several years, several years ago. And that's called the Greater New Haven Chamber.
Yep.
Have we thought about possibly merging with them or working with them? They have
Yeah,
lots of resources, budgets.
I worked with Garrett
Yeah.
for years. He worked at UI many years ago, so I'm very good friends with him, and I have talked to him, and, you know, it's been something that, yeah, you have to explore all opportunities, right? You know, you're either growing or dying, so you gotta look at what's out there. There is very much, do we want to preserve, you know, that it is an orange chamber? Because what could very well happen is that we're just part of the Greater New Haven Chamber. And what role is Orange? Well, Orange is
Small role, right.
1/40th of that equation.
I think the town really needs to decide. I mean, I feel like a Chamber of Commerce is part of the community fabric, and you're in touch with the community. I mean, we're right next to Milford, but, you know, Milford, you know, it's a lot larger. It's got 3 times the staff, 4 times the staff we have, and, you know, because that's another thing that's been bandied about, is like joining with Milford, but I think Orange would lose the identity. I mean, I'm trying to reach out, as I said, and be part of the entire community, working with the nonprofits and the local organizations and the town and the businesses, and bringing them all together. And that's something you lose. So, but if the town said that's not important, then okay, then maybe look at these other options. But to me, a Chamber of Commerce is an important part of the community and the identity of the community.
I used to do business after hours and all that. That got shut down because of COVID, right? So that.
Yep, but also, you know, again, it's about working smarter, not harder. What's the value to people that go to those? Because if you were involved in the New Haven Chamber, you're going to know exactly what I'm talking about. When you go to a chamber's business after hours, that same person you meet this month is probably going to be the same person next month. And at a certain point, those numbers kind of dwindle. And you have the same people, and at that point now, that's just a social gathering. There's no true income generation for us, and there's no value generated for the attendees, so.
And again, it's just kind of an antiquated idea. I mean, you know, chambers have been doing the business after hours for years, going out and drinking. I mean, the family dynamic has changed. A lot of people don't want to go out drinking after hours. I would rather do a family event than a business. I mean, I'm not saying I wouldn't do a business after hours if it was a new business and it would bring people into the new business and make them aware of it. But to have a business after hours at an existing business just so people could go out and drink and talk to their cliques, I don't see the value in that.
It's true.
So John, Kevin, where are we here?
It's what you want to do. It's up to you guys.
Now, they're in the Clark building, right?
Yes, they're upstairs in the Clark building right now,
And that's rent-free?
rent-free.
Okay.
John, question.
They actually share, you're in the same office as
Yeah, I have
Anne Marie, right?
one small
Yeah.
office for the chamber.
We may be moving Anne Marie out shortly. If you remember, our plans were to move her to the probate area at High Plains, and we're talking about doing that again. Now that COVID is.
Because that probate area is still vacant.
Right.
After all these years,
Right.
Beverly never did the one day a week in
A
Orange.
couple of the problems with where they are now, it's on the second floor. You have to go upstairs. It's not handicapped accessible, especially if Anne Marie is meeting with businesses trying to come into town. It's not a
Yeah, it is
real
a
good
little
look.
embarrassing, quite
Yeah.
honestly. And plus, I would love to be at the community center because there's so many people coming and going there, and it would just present so many more opportunities. I mean, I've met with Jessica from Youth Services. I've tried to reach out to the senior services. I want to get involved with all of these groups and continue to do things that are going to be mutually beneficial.
John, what's the balance of the funds available in the American Rescue Plan Act to us?
We can't use that.
Yeah,
Can't- that's-
you
can't
can't
use
use it.
Oh, so that's what we talked about, but, oh, so our request here was not
Right.
accurate. Okay, got
Well,
it. yeah.
I didn't get to him to be able to tell him that.
Oh, got it.
When we had, the three of us, I sat down and spoken about this in my office, we thought that that was gonna be a use of the funds that would be available. And I went to a seminar since then, and
I heard
I
that
was
when you
told
hit yes,
no.
okay.
So you'd either, you have two options, and you either take it out of fund balance, or we find a spot in the current budget to take it out of if you so move to fund this.
I mean, is it a possibility, and most of the purchase you're looking to do is for IT equipment, right? So would you-
Well, hours as well.
Okay.
That actually makes up the majority.
I
I
mean,
mean, because IT, I mean, how much is a new decent computer?
I didn't know if
To
you were
your,
gonna
to your point,
upgrade
Jim, you can go to
website
Best
or-
Buy, so.
There's no plans to upgrade the website then? right?
Yes,
Oh, there is.
I can get a much better website, much more functional for what we need, because the businesses aren't even using it. The chamber got sold a bill of goods with that website now. I can have one built for half price and then just the hosting fee per month. So ultimately, we're gonna realize savings, but my problem is right now is I'm treading water in an uphill battle, and I need to be able to develop these programs fully that I'm telling you about. Another one we just partnered with is Sarah, and that provides volunteer workers to local businesses. Those are the types of things I'm trying to do, but there's just, you've got the administrative aspect.
Just to back up though, the uphill battle, yes, financial, but it's time. And that really is why there is that request, because she doesn't have any administrative help. I offer help when I can, but again, gotta keep my employment as well, so, but
Are you guys planning any events?
we
Yes,
are.
we are.
And, here's, even if like this past year, here was the big difficulty is, when and what can you do? I mean, we're all wearing masks again, I got my booster, but I mean, I can, put together our best laid plans. I mean, we still have a deposit that we had, because again, the event with David Lehman was canceled mere days before it was about to be held. So we still have that at Grassy Hill. But our large groups of people, either A, are we going to be allowed to, or B, are large groups of people actually going to come out? So we do have plans, though, and we do have some things that are going to be adaptable to whatever situation is thrown our way.
Kevin?
What do you want to do? You want to table this? You want to make, what do you want to do here?
Kevin, thoughts?
Kevin?
We're kind of, it's kind of a unique situation. When I first saw the memo in my years here, it's something we've never been presented with before. We just have.
Pandemic driven, right?
Yeah,
None of us
Yeah,
have dealt with it.
It's in the world.
Like so many other things,
Yeah.
so.
I mean, the chamber is a reflection of businesses. Sure.
All right,
And-
we're trying to
I'm sorry.
get to some
Okay.
closure here. I'm trying to get a sense of the team.
I mean, they do good work, their intentions are good, I think everything is good, it's just a question of how much of the pie do we have, do we want to, that can be cut up into that? They're saying that, hopefully this will be a one-shot deal, and, it's like, and I guess it's something that as a town, it contributes to the overall well-being of the town, and, maybe we do it, and, like everything else, just take a look at it, and, try to keep it going and try to, we're restarting so many different things that, and it's a good one. It's not like, we're starting another taco stand or something like that, We're trying to do something that's pushing to do better for the town.
Yeah.
So, I mean, that's the way I kind of look at it.
All right, Kev?
Yeah, same here. I think if our finance director, John, was able to find 10,000 somewhere within the budget in the fiscal year, I don't know what the timing of your money is when it's needed, but if he could find it some way and come back and maybe report out to us where he thinks he can get it from, maybe that's an option.
Sure.
Yeah, listen, I served on the chamber, I was a board member for years. There's a lot of value in it. I know ours is small, New Haven's a lot more powerful, more larger. It is a new request to us, so it's ever kind of mulling it over and trying to, figure out what to do. We'd love to try to help you if you can find the money in the budget. John, if you think there's a way, I don't know if you want to go in, I don't know if you go in fund balance or not, but that's up to us to make that decision. I think, again, obviously, we're losing money. We're making two, we're spending 3,600.
Well, so I should point out that the way that we did it was looking at the entire year. We hadn't really reopened our doors
Yeah,
until
that's
I
right.
hired
Closed.
Kathy,
Right,
so.
right.
So the last 3 months have
So
been
we have to
much
make
better, but it's
We
a,
have to make a decision. Do we want the chamber in the town of Orange to survive long-term, or has our chamber outlived itself? I don't know.
Or, yeah, well, the chamber was created not by the town, right? It was created by the businesses in the town.
Yeah.
And that's why we've never been in this position before. Ajit?
Maybe we can give them $5,000 and then see what the progress is, and then later on find another 5,000.
Yeah?
I just listened to everybody else. I'm honest, and that's why I asked Ted, because I don't want this to be an annual thing. Because that opens up Pandora's box for
Yeah.
everybody else in the town or Scott. And that's, I would vote against that. But, I mean, it's clearly important to the town, to the businesses. We've had 2 years of, I can't even describe it, what's going on, but, so I'd be, in favor of John, if we could find it and help him out.
Yeah, what, if you wanna do something, if you allow me to use, we have a salary line item in, community services on page 21. The salary of the elderly coordinator. Right now, that job is open because he's acting as a director
Right.
of community services. So we have about half of that salary right now, so with your approval and part of the motion, I would take it out of there,
That would be all in one motion, John?
all in one motion.
Okay. So the motion would be to provide $10,000 to the Orange Chamber.
And I appreciate Ajit, with the
No, I
the
like that.
five, but
That's what I was doing with the pilot.
But I think, in this case, let's just, if it's okay with, the rest of us, just do it all.
One time deal.
Right,
One
because
time.
because it's a labor item, I need your approval to do the transfer and pay it.
Okay. And the funding would come from that.
From that
community
line item if
services
we-
line item. So who wants to make this motion? Ajit?
Okay, and
Oh,
the
Kevin's
line
got it.
item,
Kevin, I'm sorry.
Whoever.
the line item, Deb, would be 213-440-115-51100, salary elderly coordinator.
Thank you.
Okay, so there's a motion, is there a second?
I'll second it.
Second by Kevin, any further discussion? All those in favor?
Aye.
Opposed, abstained, unanimous. Thank you.
thank you
John.
very
Good
much.
luck.
All right, so Kathy, good luck.
If you don't mind, I'd like to give you all a shop local.
Sure, thank you.
We're not
Yeah.
selling them. Which, if you know anyone else, you can get them, sign up online and get them.
No, I have to buy bricks, but I haven't done that yet.
Thank you very much.
Thank you very much,
Okay, nice to meet you. Thank you.
Thank you for your time.
Nice to
Thank you
meet
so much.
Kathy.
Thank you so much.
Is Chris in there?
Thank you,
Good,
John.
thank you.
Thank you.
With us previously. Stay warm, everyone.
All right, good, thank you.
Are you guys taking a recess?
I'd like to take 5 if it's okay with everybody. Is there a motion to
Yeah, motion to take 5.
take 5 second? All right, so we'll pause the meeting for 5 minutes.
Our chamber's in trouble, huh?
God bless.
We're back?
Ready?
Okay. We're back.
Raiders beat the Browns.
Item number 4C, request to expend up to $45,000 from capital account to purchase a new vehicle. Okay, John,
Okay.
what are we looking to buy?
Yeah.
Okay, there's a little story behind it. The first selectman's vehicle is a 2004, I think it is. It's on its last legs. We had originally purchased it from the state of Connecticut at their auction. My brother had gone up and was able to bid on it and get it for him or purchase it for him. We looked out for a used vehicle for him. And as you know, there aren't too many vehicles out there right now, both new or used.
right.
And the ones that are out there are very expensive, and they have high mileage on them, and you don't know what you're buying. Then we said, the chief, the police chief has a vehicle that's 2017, which is 5 years old. It's got about 60,000 miles. He's going to be due for a new vehicle pretty soon. So we said, instead of going out and buying somebody's used one at a high price, let's see if we can get the chief a new vehicle and then take his vehicle and give it to the first selectman. Luckily, we were able to go out. You can't even get police cars right now. We were able to go out and we were able to get one for the chief that can be delivered end of February, middle of March. So they're holding it for us, and all we need is your approval to spend the $45,000 to buy it. We'll get that vehicle, we'll put the lights on it, and then we'll switch over the chief's vehicle to the first selectman.
Is it a car or SUV?
It's an SUV. They're both SUVs. So that 45,000 will be the car and the lights that need to be put on it.
Yep. It's coming out of capital.
Coming out of
plan.
capital.
Was it budgeted already for this year, or is this a
No.
new request?
This is a new request.
But he would have been coming to us next year anyway,
Probably
you
next
think?
year, yeah.
And we have to,
I remind him of that when, in February when he comes.
That's one car. Here, you got minus one.
Okay,
no, if you could get a new,
I'll make a motion
Police car.
to expend $45,000 from capital to purchase that vehicle. Or, do we have to find anything else about it?
Now, just once you say out of the capital account, we take care of that.
Okay.
That's car and full outfit.
okay, there's a motion by Jim, is there a second?
I'll second.
Second
Joe.
by,
No, you guys say, you guys go.
second by Kevin. Any further discussion? All those in favor?
Which
Aye.
Kevin?
Aye, abstain,
you.
opposed,
Moffett.
unanimous?
Okay.
Thank you.
K and K.
Okay. 4D, request from the pension board for up to $12,000 for an RFP for defined contribution plan.
Okay, I gave you a copy of proposal. The pension board, which are the trustees along with myself of the pensions, and believe it or not, we have two different pensions. We have the defined benefit plan, which has been closed since '98, and there's only about 7 people left that are active in it that are still working for the town. And there's 30 million in that. And then we have the defined contribution plan, which is the 401 for all the employees that have come in after that. And there's actually $29 million in that now, too. Mutual of America has been the holder of record of those funds since the day it was started. And we've been led to believe that we may be able to save some money now if we go out and do a RFP and see what's out there.
Which one, John, are you doing it for? The defined benefit plan or the?
Defined
Yes.
contribution plan.
Contribution, that's what
Yeah,
we're talking about
contribution,
here?
that's
it,
Right, okay, thank you.
Right. Feudation is our advisors for the defined benefit plan. They oversee the funds and they watch the managers of the mutual funds and.
Now,
when
are they
there's
gonna be a
change of-
bidder for this other one as
No,
well?
they're gonna be the people, the consultant that helps us on the RFP.
All right, good. That's
So
what I
their,
thought.
their
Yeah.
proposal is right here for
Yep.
$12,000.
Right.
And it's gotta go before the Board of Selectmen. So if you would kindly make somebody kindly make a motion for that $12,000, it would be subject to approval by the Board of Selectmen of their contract.
And where's this come from?
This is gonna come from that same line item that we used for the Chamber of Commerce.
Oh, there's more money there to,
Yeah.
Yeah, the 60 grand.
That line item is carrying 66,000, and we're halfway through the year, so we got about 33 in that line item that we could use.
okay. And you're a member of this board, so you're strongly in favor of this?
Yes.
Seemed like a well-written proposal.
Yeah, I'll make a motion to move forward on the 12,000.
We've been told that the fees that the employees pay, because it's part of when you buy and sell the mutual funds in your account.
Yeah.
The fees may be cut by 50%.
So that'll make our people happy.
Yeah.
Yeah.
And as a trustee, we're doing our due diligence
Right.
on
Okay.
that also.
Okay, so there's a motion by
I'll
Kevin,
second the motion.
Sure.
I'll second that.
second by Joe.
That will use the same account that we use for the chamber, and subject to Board of Selectmen approval of the contract.
Yeah, Kevin said that.
Okay. Good.
Okay. Any further discussion? All those in favor?
Aye.
Aye, opposed, abstaining, unanimous. Great, thank you. Back to the agenda. Item E, request $25,000 for funding for bicentennial committee planning activities.
Okay. This is me again. This came through the first selectman's office. They originally asked for 50, and I cut them down to 25 right now and said, start with that. This is gonna be used for their startup costs on the committee. I know they're talking about having additional fireworks or another night of fireworks and a parade and doing, I think they're gonna have a play like we had on our sesquicentennial.
Yeah.
Kevin and I are old enough to remember it was in back of Mariel here for 5 nights, I think it was.
Yeah, that's a long time ago.
It was a long
Yeah, I got
time.
old photographs of my house somewhere. Yes, Bob Reed did have a video of that.
Yes, oh, it's on OGAT all the time.
Oh, really?
Yeah,
It
the
is.
parade, that was
seen
down
it,
the road,
yeah.
down the post road.
I
Okay.
think there was even, wasn't there even a balloon show down the Little League?
Okay.
I think
I
there
don't
was,
know.
because I remember going up in the score box to watch it and
Alright.
stuff. So anyway, so that's for the bicentennial. They're gonna be back for more. I would, my only place to take that is probably out of our fund balance. And we'll set up a line item in the general fund for it.
And the head of that committee is Patrick O'Sullivan.
Right.
Who else is on
There's
that
a
committee,
whole
John?
there's a whole bunch of people. Father Norman from Holy Infant, I know, who's on it, and a whole group of other townspeople that either asked to be on it. Bob Heisa, he was on
Oh,
he
good
was on
man.
the bicentennial
Man, that's a
committee,
real
so
good
he's on
resource
that.
right there.
So there's a group of people. I don't even know them all.
Could you ask Pat for a list of his people?
I will.
I'd be interested,
I
just,
will.
I don't know if it's an OBOF thing, but why don't we distribute it to the team here? I think that's, if they're gonna be coming back for more, you know, I mean, why not?
Okay.
So, yeah.
What I'll get them, the next time they come back for money, I'll get Pat to come in to even, if I can, give you an idea or give you a
Give us an update.
written report on what they plan on doing.
Oh, the best report would be, what are your activities and time? That's all.
Yeah.
Somebody put it visually and then talk to that, that's all. You know, I might kind of get a sense of what's happening when. You know, this will happen over a couple weeks, and the last week would be whatever. I mean, I could help with templates with that.
Not that, spending $25,000 on fireworks kind of
Yeah.
sounds like, but,
Yeah.
Well, I think-
for the 200th anniversary,
It's a good thing.
if we're out of COVID, hopefully by then, I think the townspeople, it'll be a really
Well, if you
coming up.
remember,
nice event.
if you remember, they bought all for the was it bicentennial?
Oh,
The Sesquicentennial.
Sesquicentennial.
I can't
Remember, they
speak.
bought all kinds of like knickknacks.
Oh, yeah.
And things, so those are gonna cost money to buy and
Then we'll sell 'em.
to get the revenue back on them.
Have the
Well,
guys
yeah,
with the
well,
push
we
carts
could do
like
a
they used to have at Yale
GoFundMe
Bowl
thing.
With all
That's right.
the banners and all that stuff.
Yeah, we could do a GoFundMe thing for this, you know, there'd be people in town that might
Oh,
wanna,
I'm sure there would.
You know, we had the, what do they call it, a 2% club,
Yep.
right? Went for the fireman's thing, right, give a grant, you know, and then, 2,500, 5,000, I mean, I don't know, but it's better than zero, right? So that, I
Well,
mean.
it's better than coming out of the, the general fund and that kind of stuff too.
Well, and it gives people the opportunity
Yeah,
to,
to contribute
to
towards it.
contribute, have your name out there. I
Yep.
mean,
It's a
this
big
would be,
deal.
we do that for the,
We won't make
the
the
fire,
choice.
the town event. So maybe there's another idea.
You get Kathy to sell some more bricks.
Yeah, there you go.
Okay.
So
All
where are
right,
we
so
on
we
that?
need a motion to take $25,000 from fund balance,
Who hasn't
right?
done a motion yet?
I'll make that motion,
Joe?
Mr. Chairman.
Motion by Joe. Is there a
Second it.
second by
Okay.
Kevin?
Sure, good.
Any further discussion? All those in favor?
Aye.
Aye, opposed, abstaining, unanimous.
All right, so that one's
Thank
done.
you.
Amity.
All right, Jim, your Amity, or Jim and Joe, your Amity update's been reduced because of the hour of the evening,
How
so.
about 2 minutes?
Amity update, Mr.
Well, I have a
Nuzzo.
Two
shitload of
minutes.
slides, so.
Both talk at the same time.
All right. So the hot topic of the night, again, budget discussion. I think as we've all seen, the initial budget request was 7.16%.
Yeah,
Here we go.
I was like, 7, that's all? You want to
Did
go
you guys
get
see
10?
that too?
oh, yeah.
Get the 10 million?
Well, how come I didn't get that?
7.16.
Is
That
there
was
an
in the
email?
AFC, in the package.
Yeah, I think you sent it.
Yeah, it was in the package.
It came in the package, right?
Last
I
week,
read it.
last week's meeting.
Jim, I think you sent us
So
the,
7.16, and then it's down to 5.4.
Oh. Roger that.
So we're down to 5.4% now after cutting 900,000 worth of expenses, 906 worth of expenses. I had a quick conversation with Chris Brow after the meeting, and he's thinking it might come in between 3 and 4, is what he's thinking.
which is
initially.
really 6 or more because of budget,
No, it's way more.
actual,
No,
we've
it's
been
way
through
more.
this circus.
It's way more.
Now, the medical expenses, as we see, are up 14%. The claims are at 100%, basically. It's another problem here, 99.5% in claims.
No, I think that's expected because so many people didn't do
Right.
anything,
That's
myself
exactly right.
included,
That's
with,
exactly right.
during the pandemic.
Well, what happened in that claims is the first month was really loaded up. And what's been happening every month, as you can
Yeah,
see on
that's-
that
yeah,
thing, Joe,
yeah.
every month has been negative.
Well, that was summer, July
So now
after
you're
school.
under 100%. All right, so we'll
Yeah.
see the next few months will be
Yeah,
critical.
so we'll see how it goes, but that's where we are. It was a short meeting. I know Dr. Byers is coming here to see us January 24th to present the budget to us at our Board of Finance meeting. Amity Finance Committee has to vote on March 1st. That's when the plan is, and then the ABOE to vote March 14th.
So you're March 1st,
March
so we
1st,
don't need to,
AFC.
that, it's not on the agenda tonight, but we don't have to tell you until how this board, what we want
We
to
have
see
time.
from them. We have time for that.
Yeah.
Okay.
Well, I think let her present the budget to us next month. Let's hear her budget next month, then we make a decision.
Well, why don't, you're
Yeah.
getting ahead of yourself here.
Okay.
But yeah, because I have a lot to talk about here.
My 2 minutes are up. Thank you, Mr. Chairman.
Thanks, Joe.
This will take more than 2 minutes.
Of course it
And in
will.
particular, if I could one of the things I wish to do today was for particularly 3 audiences. First of all, my colleagues, Ajit and Kevin, although Kevin, you've been here many times before. You were not here
Last year.
yeah, last number of years, all right? So this actually is what I might call Amity thoughts, all right? And so why don't I just go through it, and I will do it rapidly. There's a lot of charts, but they're simple. I'm going to talk about, to make sure the second audience is anybody that's watching on OGAT, YouTube, because although some of these slides we've seen before, each time we educate people in our town, the better off we are and they are in order to make their decisions on what they want to have for their town taxes, which is a function largely of how much we spend. So I'm going to talk about the budget components. I'm going to talk about an analysis, particularly for Ajit and Kevin, and anybody who missed it last year, Again, a set of slides, it'll go quick. I'm going to talk about the surpluses by month. There's a very distinct trend that seems to happen, as you'll see. The budget factors that we have for next year and a summary of what we have done in prior years in terms of what I termed the Orange Board of Finance's support of Amity budgets. That's for sure, Vijit, and I don't know, Kevin, how much you were glued to OGAT in the last few weeks, okay? All right, first, the town budget, all right? Now, this is in the paper in March 9th, a year earlier this year. Very important for all our townspeople to understand what we spend our money on and where your taxes go. I find it quite easy for people to be saying, we're going to give taxes down to 0. And then you hear things like, I think you all probably saw, the headline that the Board of Selectmen took no action regarding the teacher's contract for the Orange Board of Education. Well, there were some significant numbers in there, and I found out exactly what that would mean for their budget for this coming year. But anyway, 3 major components: the town departments, Amity, the high school from 7 to 12, and Orange Board of Ed K through 6, and a smaller component, as you see there in purple, for capital and debt. We've seen that before. What we're trying to educate everybody is we do now currently 62.89 there spent on education. And not only that, as Kevin's quote in the bottom mentions, that OBOE use our buildings as well, right? So major repairs to those buildings are also funded, so there would be an additional cost, which is really an educational cost. So it's at least 63%. It's probably a couple of percent higher. And also reminding it, as Kevin Moffett, our senior man on the other side of the table, is again, Kevin, you sent me your quote that I used last year. Education is important. It's 2/3 of our entire budget. But we have other things to consider. Our schools, our capital needs, and also our town departments. All right, so these are slides that have been in the paper. We've used them before, but the opportunity for others who are watching on OGAT or might see it in YouTube to remind themselves of. Okay, this is a replay. This is a replay of what was last January, the 25th, the same day when Amity came in and presented their budget. I presented these slides. And no, if there is a 3% increase, Joe, I can calculate for you what from their actual to budget would be. But it kind of runs the same as what had happened this particular year. Now, it's dated because we're talking about fiscal 19 to 20. So this will be the only slide where I walk you through an idea. All right? You had the budget at 49,548. You had a surplus of 1.950. You spent the Amity BOE $1.5 million on additional things. So your actual spending of what you said you were going to budget for was the total budget less those two numbers. So the actual spending of what you had in the budget that got approved was $46,099,307. So your surplus from what was the budget was almost $3.49 million, which as a surplus compared to the budget was almost 7%. All right? So when you look at a future year budget, you can do it in one of two ways: budget to budget and actual to budget. Budget to budget, it only went up 2.49% in that particular year. We'll do the same analysis for this year when it comes. So you can see it only went up $1.2 million. Oh, that's a very small number. However, what you're really talking about is your new budget of the $57,84 compared to what you actually spent money on in the prior year. That's the $46,099 up above. So your increase was 4.685%.
Million.
That's right, million. 10.16% increase. Most departments, most families, if you told them, hey, next year you're going to get 10.16%, where do I sign up? So when you see these numbers coming out at Amity, this team and anyone watching at home, You need to understand what they are actually spending in the prior year, and we have some history on that. The thing on the right is a graphic of the same information. I just wanted to go through it, and what you can see, I clearly did it in Excel and just let Excel do the numbers, right? All right, so we can do the same thing in future years. That's what got presented last January. When I did this analysis, I gave them this sheet, and I said, Terry Loomis, he's the Director of Finance Administration at Amity, everything was not filled in. Please give me the data in the budget, the surplus, the number of students, and their FTEs. She sent it back with this information, okay? I then created some charts based on this information. First chart shows you the number of students have gone down. Joe, this is going to be important because I found out some information that I wanted to share with you and the team. A significant decrease of 13%, almost 14% since its high in 2009. All right, so keep that 2550 number, 2549 number in mind as we go forward. The next thing we start noticing is that they've increased their full-time equivalents. Now, each time we hear about equivalents, oh, we really need this one, we don't start to see reductions, right? It might be time for us to start thinking that that might be appropriate. But that's going up. So not surprisingly, even though it's only gone up 4%, it went up even though there was a decline of 14%. Your ratio of the two, students to FTEs, goes down even more than the 14% we saw earlier, which makes sense, all right? So that's the staff per student. Now, the budget increases, as you see them, by and large, look like they average 2.38%, as you can see right there in the box, in the red line. And as you can see, more recently, it looks like, whoa, they're in the 1%. How can we ever survive with the 1%? That's a good question. We're going to have some good answers. Regardless of the 1% increases, as you can see, the average surplus, and we're going to have more charts in this, was 1,500,008, all right, 750. And that was up to the time when we did this analysis, right? But when you look at it even more closely, you can see that in the last 4 years, you have over 10 million in surplus, which was about 2.6 million per year. Okay? 2.6 million per year. Here's the most unbelievable chart, and I'm just going to slow us down, and Kevin, I'll direct it to you, make sure, just tell me if you got it. In any one particular year, and I'm going to focus on this 15-16 one here, right? When you translate whatever percentage increase is that gets approved, you get a blue number, an increase of money, right? Budget money increase. The surplus for that same year is also on this graph. So, for example, 854,000 was the amount that we needed for an increase, and we had a surplus of 1.3 million. Let's think about that. What that means is, because whatever that percent is in that year, Joe, they had an increase of 854,000, just focusing right there, right? Right where, oh, my cursor doesn't come out. There it is, 854,000. And yet we had a surplus of 1.3 million. What that tells me, in that one particular year, was that had they had 0% increase, no blue, they would still have had a surplus, the difference between those two.
400,000, yeah.
But Joe, was that an aberration? What do you see in the other years?
Same trend, actually larger.
Particularly in more recent years. Which means, except for this 1 year where the blue was just a little bit more than the orange, where the budget increase was just a little more than the surplus they had, They could have survived with a 0% budget increase. Thank you very much. And it wouldn't have cost as much to the taxpayers. This is not anti-education. This is sound budgeting. It's what we expect from all our town departments and what we expect to support the people who pay taxes in this town. And that's what this slide summarizes. In the last 10 years, the budget surplus has been greater than the budget increase requested. Now, again, this only goes up to a certain point in time, but the trend has continued, as you'll see in this future slide. And the kicker slide, which I put in the middle here, the point is surpluses overtax our residents, all right, a lot. So to those who want to reduce taxes or make them non-existent at all, you might find an opportunity in your midst. Now, this chart is trying to interject and show you that there are two types of increases, budget-to-budget increases, which we saw earlier were very low, as you can see in the blue here. But when you go to your actual to the budget, you can see that the percentage increases are noticeably high, very high. And in fact, the prior year, which is even on this chart, what was it, Kevin? 10.16%, was it? So there's more. Okay. They even last year showed in their materials future budget increases that had percentage increases that you can see on the yellow there, okay? And I was highlighting that so that everybody on this team and everybody in the town would be aware that that's what some people were planning.
And they almost doubled it.
And this is the impact to Orange, okay? And so you could see in the lower right, it's a little hard to see, but it was about a total of an increase to Orange taxpayers over a pretty short 4-year period of over $4.5 million. Requests are forecasted that there would be a need for far more money when in each of the years they had surpluses beyond the increase they had requested for that particular year. A highly unusual situation. So our position back then, which we took on January 4th, and I'll give you a copy in a minute of the note that Kevin sent to the Amity administration. All right, I made copies so that you would have a hand copy. You wrote that on the 11th, Kevin.
What is it?
You're looking at me like you don't remember, so I think I got
Yeah, before you. If it's something I actually sent them, or if it's something that
No, you actually sent it.
Oh, if I actually sent it, that's good.
Yeah, you actually sent it.
Okay.
So what we approved last year, all right, that we would support up to a 0.47%. We had the special meeting, Kevin, if you remember, Kevin Moffett on January 4th, all right, increase of the budget, and therefore the number would be the $51,023,196. And also, that part of that motion was to return all fiscal year surpluses to the towns, which was something we had agreed with Superintendent Chip Dumais prior to the current administration. Okay. Here's another chart you need to get familiar with, and again, I'll focus on the townspeople, Ajit and Kevin McNabola. As you can see, Kev and Ajit, the blue is fully through a year, all right? And then at the end of the year, you had $3.4 million in surplus. The second year, which would be 2021, is yellow. Here we are. I must have missed, or I didn't have the data. And woe and behold, like a hockey stick, it flies up at the end, right, Kev? And here we are in the current year, the gray. And Joe, I put this current surplus. What I observe here is that a couple of trends, they look almost the same, no matter the color of the years. And at the end of the year, it ends up the same. Okay, and the absolute data, when I send you this, is in the bottom there in the Excel chart, all right, which creates the graph that you see here, all right? So that's how you see. And what you notice is when they present to us in January, their surpluses look like this. In February, when we're discussing it, their surpluses look like this. When we get to March, when we're voting, the surpluses look like this. And at the end of the year, lo and behold, the surpluses look like that.
So at the end of the year, it is cumulative.
Everything is cumulative. What happens is in the last 2 months, magic happens.
Yeah,
Okay?
no, things don't get spent.
Joe, this is the student enrollment. We showed this last time, but I want to show you it again, and I'll show you why. First of all, that's the report. It shows you, and that's how we get, and we did this slide last in November. I think everybody here was here, right? And then the next slide was, even though Orange was going down in population, all right, 13, right, from 2020 to 2021, we are going down at a slower rate than the others, and so our increase of the population, the total pie, went up by almost 0.4%. And that will mean without anything else happening to the budget, the Amity, we will be charged $197,000 more. So if Amity had a 0% increase, we would be charged $197,000 more. Here's what I've noticed, and I don't know if you can see it. You see the number in grade 12 there at the bottom, the total? What do you got there, Kev?
405.
405? They're leaving after this year, the current year we're in. And they're coming in from 6th grade. So, Kevin, what do we got over there?
337.
337 coming in. Now, can somebody else come in? Sure, right? But other things being equal, you're going to have 68 fewer students next year. Not 5, not 10, 68. For which this budget that you showed us, Joe, is intending to support. So now you're actually down under 2,100. The math says 22,098. Okay? So you can see that this trend that's been going on since 2009 or 10 down here actually goes under the 2,100 mark. Okay? And I think that's important for budgeting purposes. Okay? Certainly if the students were increasing, we'd be hearing about it. This is the same chart you saw earlier, but I tacked on, and we saw this in November. All right, and it's a slide that I showed a while back, which talked about that surpluses is our necessary tax burden to every taxpayer in Orange, Bethany, and Woodbridge. I showed you that on September 20th. I tried to jam it onto the slide, to be honest with you. It's force-fed. And the same thing over here for the most current year of what the budget was and your actuals to budget. Okay? That's significant. So I wanted to catch you all up on, as brief as I could and as succinctly as I could, and to communicate this to all of you and anyone watching on OGAT. Okay? Final one, our support of Amity budgets. Here's what I was able, thank you, John, for your assistance in sending me the, I asked John to help in tracking this down. Last year, we agreed, actually on January 4th, all right, for a 4.47 increase with all surplus money returned to the member towns. We are doing this in light of this information, okay? In light of the raging surpluses. okay? And the way we did it was ask everybody's opinion of what they would think would be an appropriate increase of Amity. You remember that, Joe? You voted 0, as a matter of fact. So did Pat Romano, who's sitting here, okay? Others had different numbers. We came to an agreement. I made a motion, and that's what we came up with. And that was the chairman's letter, which I will now pass out hand-wise. I have it electronically, but I just wanted to show it to, particularly to Ajit and to Kev, one of our 3 Kevins. And John, I don't know if you have it. There's a, whoops. Any help for team? Okay, thank you. In for fiscal year 2021, we came up with a 2% increase. That was in the February 13th meeting notes, so that's when we did it. All right, and we gave the authority for the chairman on his own discretion to increase that to 2.5 if he so desired. All right, in both cases, in both years, it was unanimous by this board, whatever we came up with, because that's kind of how we operate. In 1920, the notes of the meeting of February 4th, John, you provided an email to yourself that the words were, we strongly desired a 0% increase, what we would support up to a 0.5%, 0.5% increase, and it was also unanimous. And in 1819, we said we would support up to a 0.1% increase, and this was in our meeting notes from the meeting on February 2nd, and it was also unanimous. So I wanted to provide a reminder for 5 of us, 6 of us, counting Deb, and an update for Ajit and Kevin McNabola on what we had done in the past. You probably heard bits and pieces of it, but now I took the time to try to summarize it in brief space here. All right, so that's my Vice Chairman report. And what I wish to do, Kevin, is to talk with all of us, and starting with you, regarding a possible vote on a percentage increase to support this budget, in whether to do it tonight, to have a plan to do it on a date, or have another meeting, a quick one like we did last year to do it. I'm open to all kind of suggestions on that.
I think we hit on it with Joe earlier, since they're not going to vote until March 1st. If she presents her budget to us in January, we vote that night.
Okay.
We discuss her budget, whether she stays or not, and give her.
That's what we
give her
did.
guidance.
I think we, I'd have to go back. Well, last year we did it.
Last year we were on Zoom, yeah.
Well, we did it on oh, that's right. She presented her budget on Zoom?
Yep.
Oh, that's right. Okay. But I know I was trying to get it because I don't want to do it, wait till February because it feels like it's a little bit too late. You know, Joe, in terms of the budget increase, could you tell me what the amount of the increase is? At this current proposal level?
Well, if you're going up, what, 5%, so it's a 5.4% increase.
No, I want a number, Joe, is what I'm looking for.
I'll give it to you. So the current budget for us is 25,236. So 5, you said 5.4 times 0.054.
But that's not going to do it, because we had a student population shift that's going to be even more.
So it's gonna be 1,362,000 plus, I think,
197.
197 more, so it's over $1.5 million.
Is
Well-
our increase.
Just us, yeah.
You see, I don't see this changing.
Good try.
You know, if we were talking of surplus of like 400,000, there'd be no need for articles and presentations. This is just a failure of seriously budgeting properly. I mean, how else can you do that?
Well, but that's one of the reasons our fund balance is where it is because of the surpluses. Because even in the past few years, when we got aggressive and put 500,000 or 800,000 in the current budget,
Right.
we got, I think the year we put in 8, we got $1.5 million.
Well, if we get, well, they have already taken out of that surplus, where is it, Joe, 500 and some odd?
Yeah, we've allowed them to take 1%.
Of the budget, which was about
To spend
500.
as they wish.
Or for capital, they moved
They
it.
asked for 2% this year. we
This
said
year,
no, 1%.
and thankfully, the board went against her and didn't give her
Well,
the
remember,
2%.
They came to us with a 2% increase, and they expected to get it. So what we did at the AFC meeting is we made a motion of a 1% increase, and we unanimously
Keeping
approved it.
1% of the fund, yeah, the
Yes.
surplus.
They asked for 2, so we just didn't vote on that motion. We made our own motion, and he voted for 1, and that was it.
Yeah,
And
but
the
they
ABLE was
also,
okay with that.
they also did, besides getting that 1% though, they spent money out of the surplus
Yep.
for stuff they
Yeah,
took out of their
yes,
budget.
Yes.
So you
That's
can't
in this-
forget that
no,
either.
that's right here, too.
I don't know if they did that last year also,
they did it
John,
last
but they
year.
might have. It's the weakness, and Joe, you're gonna have to get a lot firmer on this one, I think, and I'd be happy to support you. The weakness happens right here. Right here. You see, when you get to April, everything's fine through the year.
During the budget season.
Well, it's fine in the sense that you kind of know it's there, right? But here's what happens. In May, sometimes you get the May report, sometimes you don't, right? So maybe in the COVID year, it was tough, okay. But what happens in June, when you get that report, that's the Excel file, they have already done all this puts and takes, okay? So you will see a surplus of 2.4 million, which of course I add on the 510,000 of that 1% thing to get to the true what was the surplus within that budget. And anything else that should be added in there, John, I should have added. Sometimes I'm not smart enough to do it, but you know, you would be amazed how much time this stuff, just doing what I'm doing here, takes. And you do not get to see a June summary that shows you in the, before you make changes. And we know about historically, a lot of the funding for thus and that came out of the medical dental account, right? All right? You remember that one, Kevin Moffett, right? Yep. So you don't get to see as clearly as you wish exactly where all of the obvious fat is, okay?
Till August.
Well, no, in August, you're in another fiscal year.
Yes.
You see, because the end of the year tab on the Excel file from the prior year has already done all those puts and takes. So you can't go back and say, so what is really driving that 2.4 or 2.9 million? It's harder to track it down. That's where we need to be.
And Kev, just to let you know,
Questioning more.
at the Emory Finance Committee meetings the last 3 years, the vote has been 5-1 for the no vote. And then when it goes to the ABOE, it's mostly been unanimous too. So they're not hearing our message at all.
Last year, we had, because I had spoken to Matt quite a bit, I think the last couple of years, we started getting some, because Woodbridge started having a population shift. And, you know, with the mill rates, like 43, 44 right now. But Bethany, who used to be a great fighter on our side, you saw this. If the budget stays the same, their budget's $381,000 less.
Yeah, over a
For them,
base
that's huge.
Yeah, over their base, which
Yeah.
is much smaller. right?
That's enormous.
Yeah, you talk to anybody in Bethany, the only thing that's wrong with the Amity school system is that it's not 1 through K through 12. I don't hear a lot of parents in Orange rooting for Amity K through 12.
No, not at all.
Not at all. We need more of this. So anyway, I'm gonna, I won't say what I'll commit to, but clearly, we need, we need to share this information with as many people as we can. As you can see, in every single year, all right? Every single year, right? Going back to that one chart that I showed you, right? Every single year, the amount they said they needed for an increase in order to educate our kids was dwarfed by the orange bucket, the orange bar chart, which was how much they had left over at the end of the year, for which our residents have already been taxed.
So Jim, why is it jumping in May and June? I still don't get it. Like up to April, like on your previous slide, it was 500,000.
They're just hiding. They're not
Yeah.
telling us what their surplus is until the end of the year. They're just playing games.
This one till April, like those are not real numbers.
Yeah.
Well, no, if I were, I don't want to get to contentious.
Yeah, I don't wanna
What
say
words
anything
I
bad
have
about-
heard have been something like this, Ajit, and this is a very good question, by the way. We want, well, in the medical and dental, you could say, well, you never know, could have a rash of, whatever. But you can do that in every single account, okay? They're very, very conservative, okay? But I do think there's a lot of validity in the idea that, you know, it can't come as a shock in May and then in June that all of a sudden there's all this money there. And certainly if you knew that this has been happening for 4 years under your watch, you'd think you'd dive in a little bit harder. And you're right, Joe. As long as the members of the Amity Board of Education are not more into the numbers or persuaded by the fact that this is not a good way to treat our taxpayers, for all the good and just reasons, and we all want our kids to be educated well, right? But clearly we're educating them well, and we still have these massive surpluses. We can still educate them well, have less surpluses, and have less burden on the taxpayers. That's the point.
Okay. So
Thank you.
we'll vote on that after she presents to us in January. Hopefully that meeting does take place right here.
Okay.
Item number 7, discussion and approval of minutes from November 15th, 2021.
All right. John, you're batting lead off, boss.
Let's see. Page 1,
Whoops.
under introduction, let's make it Chairman Houlihan welcome Mr. McNaball and newly elected instead of appointed to the Board of Finance. Mr. Jan, also a new electee, would be arriving later, so take out appointee and put electee there. I think that's the word.
Yeah, that's what I had on that page. So good.
Okay, on page 2. Under number 5, under Finance Director Cifarelli shared the content of 3 emails regarding funding from the American Rescue Plan. He explained that the initial proposed budget was not approved by the first selectman, who responded to Mr. would like to come before. Approved isn't the right word. I don't know what we want to put there. Because he doesn't approve what they were asking for.
Accepted or something
Was
like.
not supported by the first
Supported,
selectman?
that would be a better word.
Good
Let's
at it.
use supported. And we all saw his email going back and forth.
Yep.
And then the next paragraph, did not get adequate patient information to be reimbursed by the federal government. It shouldn't be the state of Connecticut. Losing approximately 70,000 in revenue.
See, losing spelled wrong there? Losing?
Yeah.
Well, losing, I didn't catch that, but that's
He
good.
he avoided the $70,000 loss. If you-
Yeah, but I said it, and,
I know.
yeah,
He
that's
avoided
all.
the plague,
That's all I had.
Okay,
like the pandemic.
I hear you. I got a couple if you want me to go. Back on page 1, team, I would like to put between, on section 2 introductions in the second line, due to a prior commitment, I would like to put in for Ajit, a prior teaching commitment, Deb. Okay, thank you. I think that's accurate, and I think it explains things better. In the last sentence in that very same introductions paragraph, after the words appreciation for Mr. Shanley and Ms. Romano, expressed his sincere appreciation for Mr. Shanley and Ms. Romano for their work on the Orange Board of Finance, comma, and then wish them well, stating that they will be missed. I think that's what he said, and I think it was well stated. On page 2, on the top, I don't know if this is another, is it the second thing, second bold for a third paragraph down just before number 5? Mr. Moffett made a motion to appoint Joe Nuzzo or nominate? Nominate?
Yeah, nominate.
Yeah.
Nominate,
Yeah, nominate, thank you. On item number 5, after the, in the first sentence, in the first bullet, American Rescue Plan Act, ACT, and that's the way we're going to remember it, ARPA in the future. He explained that the initial proposed budget was not, you already put supported, okay, good. Second one, Mr. Cifarelli, I think you already did some editing here, did not get adequate patient information in order to be reimbursed. In order, 2 words after information, Deb? Okay, if we added that, I think it would be good. Joe got the thing on the losing. What I would do, but you guys can edit it, I edited it slightly different, Joe. On the sentence that ended with federal government now, we took out state of Connecticut, right?
Reimbursed by the federal government.
Federal government. I put a period there. And then I said, consequently,
Excuse me.
the town lost approximately $70,000 in fund reimbursement. In other words, I'm just trying to do cause and effect, but if you guys think keeping it the way it is, I don't think it hurts it too bad.
Not even question.
Okay.
Reimbursement was credible.
In the Joe Nuzzo Amity update section, I'll call it, the final section there on this page, Joe, it felt like what we have there is 5 sentences, really. And it felt to me that the last sentence was really tied to the first sentence, you know? Or the first and second sentence. In other words,
Oh, yeah, she mixed them
in
up.
other words, you know, you were saying something about the pension plan.
Yeah,
You said there was a surplus of 374, which was not tied to the pension plan.
No.
Okay.
True.
So, to
Different
me,
bullet,
I numbered the
separate bullet.
sentences, 1, 2, 3, and then 4, 5 in the second paragraph. And I said to myself, well, 1, Mr. Nuzzo discussed the performance of the Amity pension plan, the trust, and the second severance. Lastly, no changes in the portfolio were recommended at this time. Those 2
You
are
mixed them up, yeah.
together.
Yeah.
Then you said, a second bullet, really,
Yeah.
there is a common surplus of 374, right?
Amity surplus.
Amity
of course,
surplus,
yeah.
yep. That would be a bullet.
Let's rearrange the bullets.
Yep, well, hold on, I'm gonna rearrange them right now. Then the third bullet would be the medical and dental claims. That sentence would be a bullet. And then you reported that 10,000 was reproved for 10 vapes thing. So those felt like they were, yeah, it might be better, you know, combined that way. That was my thought anyway. And Kevin, that's all I have.
Okay. Anyone else? Okay, so is there a motion to approve the minutes as amended?
Sure.
Motion by Jim, is there a second?
I second.
Second by Ajit. Any further discussion? All those in favor? Aye. Opposed, abstained, unanimous. Great.
Okay.
Okay, item number 8. This reminds me of, I'm gonna pick on John. I had a venture capital client who was, this guy was gonna, they were looking for investor money years ago, and he wanted to show that, you know, his company had money. And so his financial documents were dated September 31st, of which clearly there is no such day. And I don't think we have a November 31st anymore.
November 31st? Oh. Is that a-
John,
I was having a bad
right
Friday.
there.
Major violation.
Yeah, well, come on, I think it's more minor. We settle on medium.
So does anybody, you know, to be a little expedient, I guess, does anybody have any questions on these? I really don't want to go through page by page.
No, we're good.
Is there anything you want to bring to our attention, John, or we're just moving along?
No, I think we're just moving along. I mean, there's a couple of areas, I've told you, the tax collector area, we're gonna go over budget a little bit because we're buying some new equipment in there.
Right.
And we're
Kev, I
trying-
got one I
we're
want to
trying
show you, and I'll not say
We're trying
anything
to
more
find
about revenue.
somebody for part-time for January, but we brought in a scanner, so when you send your check in, Kevin, if you don't do it online.
No, I'm gonna do it online. It only cost me
Okay.
$1 or $2, whatever it
We're
was.
gonna, and one of the other things, the tax bills for January, the supplemental ones went out very early. We had them printed and mailed by the same company this time. We plan on doing that in June. We found out, yeah, yeah, the guy was here, the owner was here. I had a couple of meetings with him, worked out very well. The one thing I can point out, I think in our budget, in the revenue area, for supplemental motor vehicles, we budgeted 525. The bills went out at 850. So we could have a little extra collection there.
Good.
That's surprising, you know, that people would be able to find a car to have a supplemental motor vehicle bill, but that's good.
Kevin, I'd like to just show you this, and John, I'm going to send you the Excel file. I think this will help us. Where are we on the major thing called tax collector in our revenue report, which is over 90% of our revenue, right? It's real property, personal property, and motor vehicle, right? So I went back 3 years, and I just looked up a couple of months. And I think there's certain key months to track. I did a lot of the ones from last year, and as you can see, we are ahead of where we were last year. Doesn't, you know, it doesn't make it prologue for the future, but it gives you a sense, all right? So John, what we can do is just plug into this Excel document each month, right? And the next 3 months, pretty much by March, you know where you're gonna land, right? And as long as we're, you know, grenade close to 100%, I think we're all right.
Just category violation.
What do we got?
Spelling. The word category.
I accept that as an opportunity for improvement. Thank you, Joe. It was a V1, Joe.
It's a V1.
And for those who have trouble with this, I've also created this, and John, I think I've got it right in terms of how you read our famous revenue report. And so if your eyes glaze over when you get this, if you have this little thing here, it sometimes is helpful. Thanks, Kevin.
Thank you.
Simplify it.
Yes.
Okay, very good.
Keeping it fair, even if I
Old
can't spell,
business,
Joe.
Keep it fair.
I can never pronounce that storm name. Anything new there, John?
No, we haven't gotten any more reimbursements there, unfortunately. I will keep you apprised of that.
And Dr. Byers, we know she
Yeah.
intends on coming to January.
Now, you would want her next month first before Michelle, correct?
Yeah.
Yeah, I would say.
We
We
don't
should
want-
have Michelle come like an hour after we start, because,
That's what I was thinking, probably 8:15, maybe
Yeah,
even
'cause if we have
8:30.
Michelle, yeah, we don't wanna.
Business associate?
Orange, no.
All right, so she's coming in January, OVNA possibly January?
No, I'm gonna push them to February.
Okay.
Otherwise, January, you got too much.
John,
Like tonight?
Yeah. Well, January will be even worse. You know, you figure Orange Board of Ed, Amity Board of Ed, your discussion afterwards.
budget.
Michelle's about an hour, so you're talking about 10 o'clock just with those and
Yeah.
whatever else we have to do.
what is this, January?
Oh, we'll have to
Yeah.
go over our agenda for our,
The all-day meeting.
all-day meeting in February. I'll have that for you next month,
Hey, John,
yeah.
can you get me for Ajit, what is the, is Orange Business Associate the one that we use here? And the, okay, there's a password and we'll get it to you.
Okay, so the last item, adjournment. Is there a motion to adjourn?
Wait a minute, I'll look and see if PJ's watching.
Second by Kevin, all those in favor?
That's the seat
Aye.
has to,
Make the motion?
Opposed?
make the motion. That was
Meet-
PJ's seat.
Meeting adjourned at 9:55. Thank you, everyone.
Thanks, Steve.